Very good morning, sir, and all.
Good morning, madam. Good morning, all. And this is Chandra Mohan, physiotherapist from ExRxIndia, that is the exercise testing and prescription organization. And we welcome for this QUESTCON 2021 post-conference e-poster presentation. And we are having more than 40 students going to present. And before I start, I would like to welcome our guest, Dr. S.S. Subramaniam, Principal, Sree Balaji College of Physiotherapy, and our associate member, Ms. Duna, and our juries, Dr. Pushpendra Yaduvanshi. He is an associate professor and head Department of Physiotherapy, Career Point University, Kota, Rajasthan. And it's his birthday. Wish you a very happy birthday, sir.
Thank you, sir. Thank you.
And we are having Dr. Balasubramaniam, senior most physiotherapist and former principal in a private college. And he is presently working as a grade 2 physiotherapist, government headquarters hospital, E Road. And I welcome all our participants. And without wasting much time, let us start the program. And here I'm going to share the screen. And Duna madam, kindly take care of
Timing, sir. It's okay, sir.
Yes. Yes.
They will be allowed to speak for 5 minutes, and there will be question and answer session for 1 minute. And there will be a bell ring at the timing. Okay, so be prepared with that. And you must switch on your cam while presenting your paper.
Puna ma'am, one more suggestion. Can you please ring a bell at 4 minutes so that you will be alert? Then we have to.
Okay, sir. Fine, sir. Sure, I can.
One bell at 4 minutes, one bell at 5:50 minutes.
Okay, sir. Final bell.
A small bell at 4 minutes and long bell at 4 minutes.
Okay, sir.
Madam, is visible?
Yes.
Yes, sir. Visible to me, sir.
Yes, sir. It's visible to me too, sir.
Is the right slide I have put?
Yes, sir.
Yes. Duna madam, when you start with the timing, you just say ready and the presenter,
sir, it
please
is 9:54 at my clock. At 9:55 we will start.
Okay.
It will be proper timing then.
Okay. But it will again getting changed for every presenter, madam. Kindly take note of it.
Yeah, I will take.
Yeah. Presenter can go on video, and yes, that is mandatory. Yes, good.
Yes, okay. Please start, Harshika.
Yeah, ma'am. Thank you, ma'am. A very good morning, respected all teachers and all attendees present over here. Myself, Harshika Gupta, a student of physiotherapy. Today I'm here for the QUESTCON 2021 e-poster presentation, and my registration number 2021 triple times 6 times 0 and 7. Title COVID-19, and my title is COVID-19 Deliberation on Pelvic Flow with the theme Recent Research or Advancement in Physiotherapy Practice. Before I start my topic, I would like to wish the jury members' birthday, Dr. Pushpendra Yaduvanshi, happiest birthday, sir. And I would like also to share my why I choose this topic, COVID-19 deliberation on pelvic floor. Basically, COVID-19 focuses on the respiratory system. So I would like to give the awareness and try to enhance my knowledge with this topic to that's impact on COVID-19 impact on the pelvic floor also. So need of the study to create awareness among people for betterment of evidence-based practice, and the objective of the study is to cognize the role of physiotherapy and the impact of COVID-19 on COVID flow, on pelvic flow. So what the methodology? The methodology is categorized in the data source and the data selection. The data source is found on the relevant articles or identify the based on the online portals, social portals that was including like PubMed, Science Direct, Scopus, Wave of Science, Sodganga, Elsevier, Google Scholar, Academia, and many more other. The data selection was the criteria on the selecting on articles on the role of physiotherapy in COVID-19 on pelvic floor diaphragm or pelvic flow, and the two studies, scientific studies, were found related to the impact of COVID-19 on pelvic floor. The introduction. Basically, I just remind that the COVID-19 is basically focused on the respiratory system, and it's also impact on the pelvic floor. So the relation between the pelvic floor and the respiratory system. That's why the chosen topic is discussed, and the few relevant studies are over there. And the long-term effect of COVID-19 could affect the pelvic floor as well as some generalized treatment considers. Whereas the psychological factor, that is stress and anxiety, leads to the pelvic floor dysfunctions. Definition. Here the definition is just telling us about the what is the exactly physical pelvic floor dysfunction is. So it's defined, it is the, according to the study, that pelvic floor dysfunction, PFD, it is inability to correctly relax and coordinate pelvic floor muscles to have a bowel movement. So there is some another like the causes of the pelvic floor dysfunction, like it is idiopathic. Sometimes it's a traumatic injuries, also one of the factors, and the pregnancy and overuse of the muscles, pelvic floor muscles, one of the causing factors of the pelvic floor dysfunctions. And the treatment and diagnostic purpose, for the diagnostic purpose, we go for the pyranometer test, and also for the biofeedbacks for the treatment purpose, and some yoga poses are mentioned as the picture also shown, like breathing exercises. And if I'm talking about the specifically yoga poses like a butterfly pose and the mountain pose, but used very conveniently by the therapist. And the result of my study, the more than 10 recent articles are on pelvic floor, in which 2 articles are matched with the COVID-19 flow. The conclusion of the studies, and what I learned is all over that the pelvic floor muscles has been dramatically affected by the COVID-19 outbreak. Because of pervasive nature of this virus, and pelvic floor physical therapists should be a part of the rehabilitation team, treating these patients once they have become medically stable. And at last, I really would like to mention, when I discuss with my friends this topic, and I heard generally we listen the word pelvic floor means it's related about the females. It's a myth which I want to break, because pelvic floor dysfunction is not a gender specific, because we all are human, we have a pelvic floor. So it's just not limited to the females, as this is a big myth when I discussing to my friends and other my juniors also. So this is a main motive. Another my motive is to learn the things about the pelvic floor, what was the relation between the COVID-19 and what the really impact and what was the treatment processes. And at last, I would like to mention to gratitude to my HOD, to my college, and other my teachers, mentors, and of course the ERX team. If I do a little bit good things, the credit goes to my teachers and my parents. If I do anything wrong or mistake, that's definitely I want to improve and I want to know. Thank you so much. Thank you all to my teachers and all attendees.
Good morning,
Thank you.
Harshita. It was a very nice presentation.
Thank you, sir.
I think one of the researcher also has spoken on the same topic in the last weekend also. And a few of the researchers also doing the same, like the pelvic floor importance on the COVID-19, because it was one of the neglected part. So
Yes,
how
sir.
many articles did you took it in this review of literature study?
So 2 articles are there, basically which is related to the
Yes.
pelvic floor and COVID-19.
Okay. Only 2 articles we are able to identify. Okay. Where the study was conducted?
So
These
the
2
study was,
articles.
so the one study was giving doing by the one of the intern of the Gujarat college, and other was doing in the there is a hospital which is I didn't exactly the name, but it was in India. Both are study conducted in
Both
the,
articles are in India.
yes, sir.
So what they listed what are the exercises they have given?
So basically, the one of the famous exercise for the pelvic floor, they use the Kegel, and after that they use a diaphragmatic, because the patient was suffering from the COVID-19. So we all are know that there is a great impact on the respiratory. So they go for the breathing exercises simultaneously with the pelvic floor exercises.
Yes, sir. Then
Okay,
now we
yeah.
can move on to second part.
Already
You have
started.
finished?
Yeah.
Yes, sir.
It's okay. Yeah, thank you, Harshita.
Thank you, sir. Thank you so much.
Any question from sir?
Pushpendra, sir?
Yes, yes. Rashika, one question from my side, only
Yes,
the
sir.
single question.
Yes, sir.
लेकिन जब आप pelvic floor muscle का एक्सरसाइज करा रहे हो, मतलब आपकी मसल वीक हो गई है
जी सर.
कोविड की वजह से ना, यही कहना
Yes,
चाह
sir.
रहे हैं आप?
Yes, sir.
तो क्या सिम्टम्स होते हैं वीक फ्लोर मसल्स के?
So they have
कैसे
a
पता
like.
लगा?
First, that they have a chronic, like they have a back pain, they have a complaint of back pain, and if it is more contracted, they have a tightness of the muscles, or if this is flaccid, then a weakness. It depends on the symptoms, but basically they feel not that much strengthened when they are doing their ADL activities, as per the studies and as per my knowledge, sir.
I'm asking that when you start any regime of the pelvic floor, you
Yes,
say
sir.
that you strengthen your muscle.
Yes,
In
sir.
COVID era, what type of symptom you feel that particular patient was suffering from the COVID? What type of symptom you can assess in the patient of the COVID, those pelvic floor muscle you strengthen here?
So like they are complaining about they are feeling about that they are facing difficulties in their ADL activities, like
No,
if they
this is the problem of the lungs, difficulty in the breathing. But
yes,
when you correlate with the pelvic floor, what
yes,
type
sir.
of symptoms you feel? Patient feel what type of symptoms patient feel in respect to the pelvic floor?
Like sir, they have a difficulty in walking, especially because the pelvic floor are not supporting it that much, and of course because they are suffering from the COVID-19, so they simultaneously symptoms of the respiratory system. So they are complaining both that they are not able to like squatting positions if they are sitting, and they want to do like holding time, which is the patient holding time जो एक particularly normal person का रहता है वो नहीं हो पाएगा.
The answer is that
yes,
the symptoms of the weak floor muscle, leaking of urine when coughing,
It's an incontinence.
sneezing, laughing, and running also. These
Sure,
are the
sir.
main symptoms of the pelvic floor. Those person are suffering from the COVID-19.
Sure, sir. I will definitely keep in this mind, sir. Thank you, sir.
Thank you, Arshika.
Thank you so much.
Thank you. I request Duna madam, can you go for the second slide? So
yes,
that
sir, I will be trying to present, and I will be checking if I can play the sound together with.
yes,
Ashika,
yes.
you can switch off your video.
And the kind request to our juries, kindly note that 1 minute extra 10 to 20 seconds can be taken for discussion.
Is it visible?
Yes, madam.
Okay.
Go for full screen.
If I go full screen, then I won't be able to play the sound, sir.
Okay, then I will manage with the sounds here. Don't worry, madam.
Okay. Then
I will interrupt, and I will also use mobile to ring the bell.
Okay,
No
sir.
issues. Yeah.
Okay, sir. Kindly inform me if you can see the full screen.
Yes, madam. Yes, madam.
Okay. I think presentation can be started.
Yes.
Good morning, sir. Am I audible?
Yes, you are audible.
Carry on.
Okay. Good morning, sir. My name is Karthik. I'm the first author, and my second author is Rajeshwari Jayaraman, and my registration number is 03. I'll be working on the topic like the recent advances in physiotherapy. Under that, the topic will be the effect of non-invasive brain stimulation in patients with Parkinson's disease. Parkinson's disease is a major public health issue. Available approaches still have limitations. Non-invasive brain stimulation may offer a complementary approach which aims to selectively enhance adaptive or suppress maladaptive patterns of neural activity. Their ultimate goal is to restore normal physiology in the affected brain networks, and in so doing, to ameliorate symptoms manifestation. The methodology that was adapted was the database searched in PubMed, Medline, Sinhal, and Cochrane libraries. Inclusion criteria was older than about 18 years of age, both genders, greater than 24 MMSC, and who had the greatest score of 5 in Barthel Index, and studies from started from 2017, and those are more in English. Exclusion criteria was history of neurological disease, different from Parkinson's disease, history of alcohol or drug abuse, non-controlled medical problems in pregnancy. The results of this study was there were about 1,411 Parkinson's patients participated, more than 52. Among that, 52 were repetitive transcranial magnetic stimulation studies, and 616 Parkinson's patients participated in transcranial direct current stimulation studies. Out of the 28 studies was this thing. The discussion was The repetitive transcranial magnetic stimulation showed significant improvement in motor symptoms. Conversely, no effect was seen in cognition. Similarly, transcranial direct current stimulation improved motor symptoms, however, not in cognition. Nonetheless, there was a short-lasting beneficial effect on gait function. When studies involved dual stimulation of both repetitive transcranial magnetic stimulation and transcranial direct current stimulation, there was an improvement in gait, cognition, and executive function. So what happens now, sir, in this thing, this usually there's a non-invasive brain stimulations has an effect like improving the functional connectivity. The synaptic plasticity has been improved between the neurons, inducing a lasting effect over the time. So it helps in altering the abnormal neuronal circulatory to a normal. It helps the cortical basal ganglia network through cortico-subcortical loops also. So what happens generally in this transcranial magnetic stimulation, it releases the dopamine, caudate, and putamen nucleus so that you get a proper kind of an action has been delivered. This transcranial magnetic stimulation will create a kind of magnetic field over which it in turn stimulates the electric field, and thereby as an overall stimulation of the brain has been happening. Similarly, in transcranial direct current stimulation, what happens? You have two electrodes, anode and cathode, and the particular cortical areas, specific targeted cortical areas can be stimulated. So what happens over here as a result? Dopamine release is happening in the striatum. So pallidal and subthalamic nucleus has also been stimulated, causing a better motor activity has been happening. So as a conclusion note, there is a potential efficacy of non-invasive brain stimulation for treatment of Parkinson's disease. Most of the studies have been telling that patients are opting for non-invasive process. Unlike the deep brain stimulation, which is an invasive one, patients feel much comfortable with the non-invasive brain stimulation rather than going for the deep brain stimulations. So that is what is about the topic, sir.
Yeah, good morning, Karthik.
Good morning, sir.
Actually, this is a much needed one for the current scenario, especially for the Parkinson's. We need to identify a lot of new invasive techniques or non-invasive techniques. So I have one question. Can we are able to use this equipment as a physiotherapist?
Yes, sir. I have been talking to the PhD scholars in Manipal also, sir. Okay. In fact, physiotherapists are doing this, sir.
That's good. So what about the cost of the equipment?
To be very frank,
it is affordable for a clinical physician?
That is little good, sir. What I have heard from two of the therapists is actually the college is actually sponsoring. So they have got like how we have an functional electrical stimulation. Every clinic is actually having kind of one. So similarly, there are products. This is one I have heard about. It's cost about around 1.5. Okay. So
what? Okay, yeah, it's okay. One more question. Why did you mention it as 18 years and old? Actually, Parkinson's will not occur in 18 years, right?
The rarely is about the studies. What they have considered is actually some are actually they're taking these studies are considered like that, sir. Okay. Very rare cases it is happening. Very rare cases, okay, but not majorly. Though it is mostly happens at the middle age and above 45 and things like that.
In your article, did they have any individual with 18 years?
They have mentioned, sir. In one of the studies they mentioned about it was a very rare. It was very rare, and they mentioned.
Okay, okay, Karthik. Thank you very much. Thank you.
Okay, sir.
Pushpendra, sir. Any questions?
One more question from my side, Karthik.
Yes, sir.
How long the TMS?
Sir, I'm not able to hear you.
Can you hear me properly?
Sir, you are not audible.
Hello.
Yes, now you are audible.
Yes, now audible.
Yes, sir. Okay. Yes, sir.
Yeah, Chandra.
Sir, I can hear you, sir.
Sorry, what happened?
Sir?
I can hear you, sir.
Yes.
Yes, Pushpendra, sir, you can speak, please.
Yes. TMS, these are the TMS is a permanent therapy.
No, sir. It is actually, sir, they are giving us stimulations for about 20 minutes to max of 25 to 30 minutes, sir.
Okay.
And the depth of penetration is about 1.5 to 3. So magnetic field has been created around the skull and then it penetrates inside, sir.
It is damage the brain or not? Can it is
Uh,
damage?
those kind of studies are not talking about it is damaging the brain. Rather than talking about the detrimental effects, sir, the most of studies are talking about the positive things, how patients are able to better mobile in the gait as well as in the motor activities are happening, sir.
Thank you.
Thank you.
Nice
Thank you.
strategy.
We will go to the next. Thank you.
Thank you. Thanks for the opportunity, sir. Thanks a lot, sir.
Yes.
Sir, who need to present the paper for her? Me or you?
You have to.
Okay. I'll be sharing the screen soon.
Yes. I have seen the message that the participant registration number 8 is not presenting now today. So we have to take a note of it.
Okay. You kindly inform me.
Yes, yes.
Can you see my screen?
Yeah, yes, yes, yes.
And please unmute.
Yes. Can you hear me?
Yes, we can hear you. We can
Okay.
start now.
Okay.
Yes, start.
Good morning to the honorable juries and my fellow peers. My name is Tan Sweetly and I'm from Malaysia. And with my co-author, Ms. Kiritika Selvakuma. Our registration number is 2021-000-0004. We will be presenting on a topic, the prevalence of exercise addiction among the students. And a narrative review has been done. Firstly, I will provide a brief introduction on exercise addiction. We are fully aware of the benefits of exercise as we incorporate the knowledge into our profession, physiotherapy, to prescribe the exercise. However, exercise should be done in moderation because excessive exercise will actually bring negative effects. Exercise addiction, in short form EA, is a phenomenon where exercise is being done excessively, resulting in a loss of control and more cravings for exercise. And it is associated with possible negative impacts, like it brings injuries to us. People that are prone to EA will result in excessive production of IL-6 and the activation of the neuroendocrine pathways, which are associated with behavioral and psychological disturbances of exercise withdrawal. It is important from the researcher's perspective to analyze the prevalence of EA, especially among students, to overcome the mental and social problems later in life. However, the studies that measure the prevalence of EA among students is very limited, hence this study aims to perform the narrative review on the prevalence of EA among students. To organize the search strategy, a PICO format was used as shown in the table. The databases were analyzed to identify eligible studies from period of 2015 to July 2021. An additional search of gray literature for this study is not performed. The search term used were the exercise addiction among the students. You all may have a look at the eligible criteria for the selection of the studies. So population, we have included students in secondary school, college, and uni students. Primary school students are excluded, and we have included the studies based on the symptoms and risk of EA as the outcome, and include only RCT and cross-sectional designs in the narrative review. We'll straight jump into the result of the study. The study yields 38 studies in PubMed and 8 trail studies from Cochrane concerning to the prevalence of EA among students. There was no duplication in the articles found. Of the 46 studies, 42 articles were excluded because 5 studies of exercise addiction was secondary analysis, 3 were the interventional analysis rather than the prevalence, and other 33 studies were focusing on other aspects, for example, like eating disorder, internet addiction, mobile addiction, obesity, and all. So, one study was conference proceedings after full screening of 4 studies were included for the analysis. Characteristics of the studies focusing on age, design outcome, measure, and prevalence are summarized in the table 2. The prevalence of EA in a study by Gun and Agribas in 2019 shows 14.1% of EA. And in the Liechtenstein study, 4% of the prevalence is recorded among sports school students. The study by Melas Pai et al. At 2017 shows 17% of EA, while lastly, 23% and 19% of prevalence is observed in students studying nutrition and occupational therapy from the study by Rocks et al. In 2017. Yeah. In short, the prevalence of EA among students varies due to many different factors, including eating disorders, gender, age, physical activity level, etc. So current studies on the EA are still very limited. Students are exposed to more information on exercise, but often neglects the importance of moderation, which may lead to a compulsive behavior, which is known as EA. All professionals, including physiotherapy, sports trainer, who prescribes exercise or any advices to the community and usually are the first to encounter EA person due to the injury or training, they play a role to take note of this possible behavior and should always be aware of the psychological health of these subjects. Lastly, we conclude that prevalence of EA is higher, especially among the students. I would like to thank my lecturer, Ms. Kirutika, who has guided me throughout the whole study. Thank you.
Very good morning, Tan.
Good morning, sir.
This topic is very useful for the physiotherapists to understand what are the normal physical activities which are conducted, which are done by the kids. But you see the physical activity ratio when we compare with the school children and the university children, there are a lot of differences, right? At least in the schools, you have the PE, the physical education period will be there, and the kids tend to do a lot of more activities when compared to the college or university students, because our university students, the physical activity voluntariness was very less because they concentrate on studies and other things, right? So did in your articles, did they mention that under any differences they have noted between the school and college students?
Because we have not studied the primary school students, so the mean age of the studies included are around 18, so it's like teenagers above. So I didn't come across with any studies that study the like younger population. So they are much more involved in the exercise, like in a school way, in the adult population, I mean.
Okay. Yeah, only you 4 studies were able to identify it, right?
Yes.
So where are the search sites you have there? What are the search sites?
Sorry?
Search sites.
Search sites?
Database.
The PubMed and also Cochrane.
Because you don't have the proper central PubMed central thing. When you search in a lot of databases, you are able to identify much more articles, I think so.
Yeah, sure.
I'm not sure about that. Okay.
Yeah, probably. Thank you.
Thank you. And sir, Puspendra sir?
No question from my side.
Okay, thank you. Can we move on to the next slide, Duna madam?
Yes, sir. Next is 5. Number 5, leprosy.
Yes.
Okay, I'll be presenting for you. Just wait.
Mama, sikro.
Duna madam?
Yes, sir. Yes, sir. File is opening, sir.
Okay.
Can you see the presentation?
Yes, madam.
Okay.
Yes, ma'am.
Presenter can switch on your video.
Yes, sir.
You can start.
Very good morning, everyone. And my register number is 005. I have chosen recent advancement in physiotherapy practice and which is tele-rehabilitation. So tele-rehabilitation is the delivery of rehabilitation service over the internet or using a telecommunication system. So what is the use of tele-rehabilitation? That could be a question. And what are the uses of it are? it is very safe. The first point is that, and it is safe for the patient as well as for therapists and during a situation like a pandemic. And it is convenient for the patient where they can communicate with us and they can communicate matter what. And it is cost saving and it is for better clinical support in rural communities. So the components of the rehabilitation services are telecommunication, teleconsultation, where the consultation services are done, and tele-home care, where it is mostly done for the pediatric cases, where the patient can do any exercises under our supervision, and tele-monitoring and teletherapy. So where the areas of rehabilitation are neurological conditions like stroke, multiple sclerosis, and the outcome measures can be done with HRQL. And then cardiopulmonary conditions like even in COVID cases, the breathing exercises and other things were done by doing rehabilitation. And third one would be musculoskeletal conditions. In musculoskeletal conditions, the low back pain, hip arthroplasty or total knee replacement can be consulted and can do. Tool and a pain scale. And general conditions such as obesity and diabetes, all those conditions can be done by the tele-rehabilitation. And tools for tele-rehab can be smartphones and apps. There is some app called as Raccoon, and which the exercise protocol can be fixed and the patient undergoes the exercise, and the therapist can view that if there is any mistakes or such, and he or she can correct it. And phone call reminders on when to do what, like exercise programs and when to have follow-up sessions and all that. And message notifications and maybe message notifications can be done. And video conference calls like they can communicate with the patients via the conference like Hangouts, Google Hangouts, and Google Meet and all that. And last one would be the educational videos where a video like you can make a video of how it should be done, and then it is step by step. And then what kind of interventions is done with therapeutic exercises, where the exercise programs can be given, and functional training can also be administered. And then third will be the education and counseling, and how should be how should the protocol go, and it is prescription can be given. And the tele-rehabilitation in India, why it is done is that elderly population are more in India. So it is very important for them to engage them in activities. So and the cost efficient because many insurances doesn't cover their rehabilitation services. So it is more important for them to go via tele-rehabilitation, so they are more aware of it. And transport charges are cut to half, so that is one of the pros of it. And there may be a potential increase in future as everyone is more adapted to tele kind of online consultations or that is running. So I think this would be a great opportunity to grow in further few years. That is all about it. Thank you.
Yes, sir. Arun, sir.
Very good presentation, because you are giving a lot of enlightenment on the tele-rehabilitation, especially when we are on the COVID-19 crisis and the pandemic hits everywhere. And we are forced to, likely or unlikely, we are forced to take the tele-rehab as a choice. But still, there are a lot of difficulties, right? Why you did touch all these components? A lot of difficulties we are facing on the tele-rehab, right?
Yes, sir. We shouldn't make it as a, it is not a replacement or something like that, sir. It is going to be a complement to our, like for example, having a follow sessions, or like for example, if a patient is, we are giving a home program. So maybe the patient may do, may not, is not, like they will do every time. So maybe it is under supervision, maybe you can use it in that.
Yeah, because when you teach the exercises to the pediatric or geriatric patient, they need some sort of supervision because they tend to fall and all the other complaints are there, right? Anyway, good presentation.
I agree.
Thank you. Thank you.
Pushpendra sir. Pushpendra sir.
Hello.
Yes, sir. Please. Pushpendra sir, any questions from your side?
Any
Sir, you are
questions,
not
Pushpendra sir, or we can follow? Hello?
I think he's
Am
having.
I audible, sir?
Yes, yes, madam. You are audible.
Can we go for the next presentation,
Yes,
sir?
yes, madam. Yes, madam. I will talk to him.
Ma'am, I'm audible.
Yeah. Yes, madam.
Yes,
Yes,
yes.
sir. Sir, any questions from your side?
Pushpendra sir, any question for the last session, last presentation?
Hello.
Yes, sir. Any question for the last presentation, sir? Can we go for the next, sir?
Yes, madam. Yes, madam. We can go for the next.
Okay. I'll be opening the file and we wait.
Yeah. I will put a message to him.
Yes.
Chandramohan sir.
Sir, what's happening, sir? Is your network properly connecting you? Hello? Hello?
Yes, we can hear you.
We request the participant to wait for a minute. Sir, Pushpendra sir? Sir, you are audible actually. Kindly check your network connectivity, sir.
Yes. It's audible, sir.
Okay, sir. We are moving to the next participant. Is that okay? Yes, sir. Yes, sir.
Can I ask one question from Rupasi?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
Yes, Rupasi. Can you?
Yes, sir.
What are the component of the tele-rehabilitation and what are the component of the clinical rehabilitation? Can you explain?
Yes, sir. In clinical rehabilitation, assessment can be made, and program, exercise, prescription, all those things will come under clinical aspects, sir. Rehabilitation, it has telehealth.
Okay, thank you.
Telemonitoring, all that would come under that, sir.
Okay.
Yes, sir. Thank you, sir. Duna, madam?
Yes, sir. I'll be showing the next. Is it visible?
Appearing, madam. Yes.
Yeah, Divyasri, kindly unmute. You are muted.
Yes, ma'am.
Yeah. You can start.
Ma'am, am I audible, ma'am?
Yes, you are audible.
Good morning to one and all. I'm Divyasri. My topic is in virtual reality in stroke rehabilitation. Okay. Stroke is a central nervous system disorder produced by local interruption in the cerebral blood flow, which is due to ischemic stroke or hemorrhagic stroke, as a result in which the afferent pathways gets affected, by which the which results in motor, sensory, and cognitive impairments. The virtual reality is a computer-based technology that allows users to interact with a multi-sensory stimulated environment and real-time feedback on performance. Since last decade, the virtual reality has been booming in the field of stroke rehabilitation, which VR has been used in neuro rehabilitation in order to encourage, as an encouragement and for increase in repetitions and intensities and to improve motor learning. The improvements can be explained by the theory of neuroplasticity. Neuroplasticity is the ability of brain to reorganize its neural pathway and ability to accommodate to the new information. Neural plasticity can be occurring by two ways, either by learning new things or by accommodating accommodating to it. In field of stroke rehabilitation, the VR has been reported to be most effective in lower limb impairments like gait training, balance, and for upper limb movements, etc. And in fact, it has been said motor learning has been shown to drive neuroplasticity. Um, Neuroplasticity is the ability of human brain to adapt to certain experiences or environments. And motor learning, there are three stages in the motor learning, which includes cognitive, associative, and autonomous. And a motor learning results in a ability to produce a new motor task. The cognitive stage is said to be an explicit stage. At this stage, the learner is new to things. He doesn't know how to start with the activity, and in associative stage he might be requiring less feedback, but he can show good improvement. In final stage he becomes in final autonomous stage he becomes automatic, where he excels the task. uh, Next, according to Carl Shepard theory, motor learning, where relearned movements are structured to be task specific. He says the learning should be in a task specific way. Then in virtual reality, we can see about immersive virtual reality or non-immersive virtual reality. The the single use of VR games is comprised of 21 inches monitor with a CYV based monitor game controller. This is automatic, and it consists of accelerator, gyroscope, and a display screen. Uh, and then it also consists of cave automatic virtual reality has been introduced in the field of immersive virtual reality. When compared to immersive virtual reality, where non-immersive reality has been seen to be a cost-effective one. And then in immersive and non-immersive can be better differentiated by the level of immersion. Immersive reality strengthens the level of immersion because less mental effort is required to be immersed in the virtual reality. And in contrast, in non-immersive reality, more mental effort may be required to immerse in the virtual environment. Wearable devices are usually divided as exoskeletons. Data gloves can be used along with the immersive virtual reality. Then the software which is used for virtual reality would be Zobox, Skynet, and Ninito V can be used in virtual reality. The games which is used in a virtual reality includes rebounds, mosquito squat, and football kicking. Then musical catch, and all these games can be included in virtual reality. Then considering to the importance of AR, augmented reality can also be combined in with virtual reality, and it also helps in the stroke rehabilitation. Um, then virtual reality has been becoming a promising tool in the field of stroke rehabilitation and can lead to better motor recovery.
Right. This is a long bell, right? I didn't realize. Thank you, Divyasri, for your excellent presentation.
Thank you, sir.
You are showing up a lot of new components in the physiotherapy field. Actually, the virtual reality is now taking the center stage in physiotherapy in many conditions, like neurological conditions and orthopedic conditions. There are even virtual reality associations are also there, and many of the Indian scholars are also a part of the virtual reality associations. So, what is the main disadvantage in this virtual reality? What you find, what you understand?
So the main disadvantage is the person with the severe cognitive impairments and all cannot participate in this, sir. And the person who is assisting them, even the therapist, need to learn lot of things in order to operate the virtual reality and make the patient to do that, sir. So without knowledge, the therapist also must have a lot of knowledge and need to go through a lot to enable the patient to do that, sir. This requires a lot of knowledge, so
Yes, but the other
If it
thing
is
is
not,
the virtual reality is little costly as an Indian setup. We are not able to make that very good, right?
yes,
Anyways, very good presentation, Divya. Thank you very much.
thank you, sir.
Pushpendra sir.
Yes, yes. Very good presentation from Deveshri.
Yes, sir.
The emerging topics, emerging field of virtual reality in the neurological patient. Can you hear me properly?
Yes, sir. Yes, sir.
One question from my side.
Yes,
How
sir.
virtual reality feedback system can help us in rehabilitation?
So the feedback system is visual and auditory feedback system, which involves in a virtual reality, sir.
Okay. What type of engaging training, what type of the advantage including in the feedback system?
So it is kind of motivating for them, saying in case if they are in a if they are put into a real virtual world, they can see lot of images. It's kind of motivating for them in compared to an conventional therapy, sir. So
Thank you.
thank you, sir.
Yes, thank you, sir. We can move on to the next presentation.
We done with the 6th, right, sir?
Yes. Duna madam, your bell ringing is more audible. So kindly manage bell also.
Trying, sir. Actually checking the time, sharing the screen.
Yeah, yeah.
It is. Still, I will try. Would be taking a little time to start.
Otherwise, there will be some 5 to 10 seconds difference in our timing.
Yes, yes. I understand.
Manage, it will be more.
Sai Iyer, your
Yes, ma'am.
audio is making a little disturbance. Kindly check your audio.
Yes, yes.
If there is fan running nearby, you can switch it off for 5 minutes.
Is the screen visible?
Yes, ma'am.
Okay, I will be just checking with the bell. Kindly see if you can hear it.
Okay.
Is it audible?
Yes, ma'am.
You can start the presentation right now.
Good morning, everyone. The topic of my presentation is multimodal approaches in osteoarthritis of knee, literature review. I start with introduction. Multimodal treatment involves several different types of treatment, usually within one treatment session. In relation to osteoarthritis of knee, multimodal treatment involves electrotherapeutic modalities, manual therapy, exercise therapy, including stretching and strengthening exercises, balance and proprioceptive training, patient education, home exercise program, orthosis, taping, and functional training. Now, how does multimodal treatment works? It is thought that various factors that can potentially influence the development and continuation of symptoms or disability in any disorder, and especially in osteoarthritis of knee. According to ICF model, apart from the symptoms which have an effect on activity limitation and participation, there are environmental factors, personal, social factors, which can also influence the outcome of interventions, which may be a facilitator or a barrier. There have also been increased benefits of providing multimodal treatments within one single treatment, comparison to one single treatment. Objectives: to determine the effects of multimodal physiotherapy approaches in patients with osteoarthritis of knee. In inclusion criteria, recent meta-analysis, RCT studies, quasi-experimental studies, case studies, and reports have been included. Full text articles, if not available, then or any other articles apart from English language were excluded. The study design was a literature review. Total 30 articles were being screened, and out of which, based on the inclusion and exclusion criteria, there were 25 articles which were eligible based on the study. And out of the 25 articles based on the inclusion exclusion criteria, 1 was a systematic review, 20 was RCT, 2 was experimental study, and 1 was a case series and a case report. Now, just description of the study. Jinal et al. Did a study on effects of traction and osteoarthritis of knee, which was an evidence-based study using a multimodal approach. That they took 50 participants and they were divided into 2 groups. One group was, both the groups were receiving a common treatment like electrotherapeutic modalities like ultrasound, interferential therapy, stretching and strengthening exercises of lower limbs. And along with the interventional group, it was receiving intermittent fraction, which was given for 10 minutes of duration. And the outcome measures which was used in the study was WOMAC, range of motion, especially of knee, a manual muscle testing of knee musculature, including quadriceps and hamstring, and pain outcome, that is VAS. And it was seen that the interventional group had a better outcome compared to the control, which uses traction. Then the second study, Alox, Sunkas et al. Did a study on manual therapy in osteoarthritis of knee, a systematic review using a multi-modal approach, where one group was receiving a Mulligan mobilization, that is movement with mobilization, and another group was receiving a midline mobilization. And the common things that was being used was the modalities, exercise therapy, which was using strengthening and stretching exercises of lower limb. It was seen, it was a comparison between Mulligan and midline mobilization. Both manual therapy approaches were effective for short-term basis, but Mulligan was more effective when compared to midline mobilization. And the outcome measures that they used was WOMAC, whose pain for VAS, range of motion of knee, and strengthening exercise. Third, Mei Hawa et al., Jahou Lin et al., and Vijay Kaze et al. In a study of effects of weight bearing versus non-weight bearing and proprioceptive training, along with modalities which were given in osteoarthritis of knee patients. And the conclusion of the study was there was no difference in pain muscle strength between the groups. But when it comes to community level ambulation, weight bearing group had a better improvement compared to the non-weight bearing group. Fourth, Brillia Bhaskar et al. In a study, effects of perturbation in improving balance and functions in osteoarthritis of knee. 15 individuals have been there, and both the groups have been treated with a conventional therapy which using ultrasound, stretching, and strengthening exercises of lower limb. And the interventional group received an additional perturbation training. And the outcome measures was time up and go test and functional reach test. And it was seen that the perturbation had a better outcome. The fifth was Krishna Kumar Singh et al. In a study of functional task training versus resistance training in osteoarthritis of knee with an outcome measure of VAS, step-up test, and walking speed test. Discussion. From the literature review, it has been seen that when two or more treatment is being given simultaneously, there is a better outcome when compared to a single one. The possible explanation comes from the concept of ICF model. There are various factors which affects the outcome of the disease. The treatment should not focus on only the body structure and function, but also on other domains of ICF like the participation, environmental factors, and etc., which may be a barrier for the patient to participate. And if such treatment is being incorporated, then their participation may increase and disability may reduce. Conclusion, from the study, it can be concluded that the use of multimodal treatment approaches can be useful in getting better outcome when compared to an individual one. Multimodal treatment targets on all the domains of an individual problems and thereby helps in total rehabilitation of a patient. Clinical rehabilitation, multimodal treatment should be incorporated in clinical settings for all kinds of disorders, and it can be helpful for faster outcomes and overall rehabilitation of patients. Thank you. Thank you, sir.
Yeah, thank you, Mr. Sai.
Yes, sir.
It was a wonderful presentation. And you have covered everything in the multimodal therapy. I just want to ask you, what is your conclusion in this ROI, Review of Literature Study? What is your conclusion?
Yes, sir. Actually, what multimodal treatment involves is many types of treatment within one session. So based on the study that I have done, I feel that we should incorporate various forms of treatment to treat a kind of any disorder so that we can help in overall rehabilitation of the patient.
But it is practically not possible, right? We cannot give everything to the patient, right? You cannot give manual therapy, exercises.
Yes, sir.
It takes long time for one patient if you are treating in the clinical setting.
Yes, that would be a time-consuming one.
Yeah, time-consuming.
So, yes. But one thing we can take is based on what expectations the patient was like in osteoarthritis of knee. If we traditionally take the patient likes to have a cross-leg sitting or squatting or like that, then we can give functional training to such patients along with some modalities and strengthening exercises, which may be useful for them to meet their expectations.
Thank you, Sai. Thank you.
Thank you, sir.
Pushpendra, sir.
Pushpendra, sir.
Yes, one question from my side. The same question from the Arun sir. In multimodal modal therapy, what would be included? It is included in the psychological aspect also. It is included the exercise. It is included electro. So, give me some brief idea about the what type of therapy you choice is the best three therapies you are including in the multimodal.
So actually, multimodal involves all forms of treatment in all, but as Sir said that it may be a lot of time consuming.
Give me the best 3 you can review.
Best 3 forms of treatment.
Pushpendra sir,
Yes.
your question was not clear.
Means when you given the therapy, multimodal therapy, so what
Yes.
type of treatment choice you given to the patient in the osteoarthritis? Just you starting from the electro, you starting from the exercise, you giving the some balance training. So give me the 3 therapies you included. Yeah, you included the psychological aspect. You give the support to the psychological aspect to the patient also.
Yes, sir. If I'll be selecting any of the 3, then I'll be selecting electrotherapeutic modalities, counseling, and functional training in treating those patients. That would be my choice.
Okay, thank you.
Madam, 8th registration is not presenting.
Oh, okay.
We are moving on to the 9th one. Who is 9th? Niveta.
Yes, sir. Good morning, sir.
Good morning, madam. Adjust your cam.
Okay,
Yeah,
sir.
good.
Just kindly wait. I will be sharing the screen soon.
Yes, madam. Yes, madam.
Is the screen visible?
Yes, madam.
Yes, ma'am.
Okay.
Am I audible, ma'am?
Kindly wait. Kindly wait. I need to check the bell too. Chandramohan sir, kindly add the participants.
Yes, madam.
Could you
Yeah.
hear the bell?
Yes,
Yes,
ma'am.
madam.
Okay, we can start.
Ma'am, am I audible, ma'am?
Yes, you are audible. Kindly
Yes, ma'am.
start speaking.
Yes, ma'am. Thank you, ma'am. Good morning, everyone. Thanks, everyone, for being here today. Myself, second author E. Lakshmi Priya, and first author M. Niveta. Our register number is 2021000009. I'm here today to talk about the topic recent advancement in neurorehabilitation, effectiveness of robots as a tool to support gait therapy in the pandemic. Abstract. In the pandemic, several healthcare services are looking for strategies to promote physical distancing and enhance healthcare procedure. So, with the guidance of robotics as a tool to support clinical care, promoting physical distancing areas, robotic assisted gait training is used to improve gait in all conditions with mechanical assistance in robotic device rather than therapist in the pandemic. A social robotic platform for neurorehabilitation with Locomat is presented. The Locomat is a device that combines the body weight support system and a robotic orthosis to assist the gait using repetitive specific task and the principle of neuroplasticity. Principle of neuroplasticity. The principles of neuroplasticity was proposed by Klein and Jones in 2008. There are 10 principles of neuroplasticity. Number 1, use it or lose it. Neural networks not actively engaged in training can degrade. Number 2, use it and improve it. Induce dendritic growth and synaptogenesis within specific regions that enhance task performance. Number 3, specificity. Nature of training dictates the nature of plasticity. Number 4, repetition matters. Required induce lasting neural change. Number 5, intensity matters. Sufficient intensity required to induce plasticity. Number 6, time matters. Different forms of plasticity occurs at different times during training. Number 7, salience matters. Training experience must be sufficiently rewarding to induce plasticity. Number 8, age matters. More readily occur in the younger brain. Number 9, transference. Plasticity induced by one training experience can enhance the acquisition of similar behavior. Number 10, interference. Plasticity induced by one training experience can interfere with the acquisition of similar behavior. Methods. The Locomat device is of 3 methods: sensory module, social robotic module, and the graphical user. Sensory module. The sensory module, which allows the acquisition and processing of physiological data. Number 2, social robotic module. This is in charge of the social interaction and the assistance of the patient. Number 3, the graphical user interface. This is in charge of visualizing the therapist's data and control of session flow. Indications: stroke, cerebral palsy, multiple sclerosis, Parkinson's disease, hemiplegic patient, spinal muscular atrophy, paraplegia, and traumatic brain injury. How robotic devices are used in physiotherapy? Robots are not new to medical environment. They are used in a variety of ways, such as telepresence, surgical assistance, rehabilitation, medical transportation, sanitation and disinfection, and dispensing prescriptions. They relieve medical personnel from routine tasks and make medical procedures safer for patients, including accurate surgery and the transport of hazardous substances. Physical therapists are crucial to the design, development, and the operation of technologies of the robotic interfaces. Assistive and therapeutic robotic devices are rapidly growing, including robots that help patient rehabilitation from serious conditions like stroke. Conclusion: robotic assisted therapy have a positive effect on social robotic patient in the physiological progress and interaction with online monitoring the gait performance and cardiovascular functioning. This became more conscious of social distancing in the pandemic, where therapists need to assess rehabilitation to maintain quality of life. Thank you.
Thank you. Very good presentation, please.
Thank you,
I
sir.
just have one question, Lakshmi.
Yes, sir.
Can we use robotic, as per your title, it says that you are using robotic for the neurological conditions. Can
Yes,
we
sir.
use it for other conditions like orthopedic, cardiorespiratory, or
Yes.
obstetric gynecology?
Yes, so we can use it for other conditions too, sir.
But here you are focusing on the gait parameters and
yes,
walking,
so
right?
yes, so the main focus is this is a recent study in neuro rehabilitation. So this is based on neuro types, sir.
Mainly to focus on improving the gait of the individual, right?
Yes, the gait of the individual, sir. So to improve the gait of the individual in this recent pandemic, in this COVID pandemic, this robotic device is used, sir.
Thank you.
Thank you, sir.
Good
Yes,
presentation,
any
Lakshmi.
question?
Yes.
Thank you, sir.
Can we use in a spinal cord injury?
Sir?
Can we use robotic therapy in a spinal cord injury?
Yes, so we can use in spinal cord injuries, brain and neuro behavior and neuromuscular disease too, sir. Like multiple sclerosis.
Because you mentioned all the things, but there is a spinal cord injury not.
Yes, sir. Sorry, sir. We can.
Here.
Yes, sir. Sorry, sir. We can use it also in spinal cord injuries, brain. We can use it, sir. Yes, sir.
Thank you, sir. Thank you, madam.
Yes, sir. Thank you, sir.
Yes, Aduna, madam.
Yes, next is number 10, sir.
Yes, madam. Wonderful time management for this topic.
Thank you, sir. Thank you.
Yes.
If you can see the screen.
Yes.
And now you need to inform me if you can hear the sound. Is it okay?
Madam. Yes, madam.
Yes, ma'am.
Okay. You can please start the presentation.
Am I audible?
Yes, you are.
Yes, thank you. Good morning, everyone. Title of my poster is Physical Activity Choices of People During COVID-19 Lockdown, a web-based survey. We all know in March 2020, WHO declared COVID-19 as a global pandemic, thus resulting in a nationwide lockdown. This lockdown had tremendous impact on everyone's daily activities, resulting in sedentary lifestyle. As we all know, physical activity is essential for maintaining a healthy lifestyle and preventing it. Like physical activity also helps in preventing chronic diseases such as diabetes, blood pressure, and some malignancies. So the goal of my study was to find out what were the people's preferences during the physical activity during lockdown and whether there were any changes in the physical activity level. People were recruited through social media, and online questionnaire using Google platform was distributed. Questionnaire was divided into two sections, one with the demographic data information and other with the information regarding the physical activity. All the relevant information was gathered, such as whether people believe physical activity is crucial for their health or not, and whether they have been exposed to physical activity prior to the pandemic. A list of certain day-to-day activities was made available and were asked to select the activities they were involved in the before and during the lockdown. As a result, can be seen in the graph, which shows that before lockdown, walking and shopping were the most popular ways to stay physically active, but which was hampered due to the COVID. However, we have discovered that the majority of the outdoor activities like cycling, jogging, gymming have decreased, while all the indoor activities such as household activities like cleaning, sweeping, cooking have been increased, along with the yoga, pranayam, dancing, gardening has been also increased. So we can conclude that the overall physical activities has been affected due to COVID-19 and does not meet the WHO recommendations of 150 minutes of moderate physical activity or 75 minutes of vigorous physical activity per week. Hence, like being a physiotherapist, we should be more focused on staying active. People need to be made aware about the importance of physical activity. Stay active by using all the resources available around us. So we can do this by sharing small videos and which could be forwarded to the social medias, or we can ask our family members to, like we can tell family members that we have to be physically active. We should be along with them. We should do all the physical activities to make them healthy. Online Zoom sessions can be conducted. I'm grateful for all the participants who have participated in my survey. Thank you.
Thank you, Gauri. I think you are not aware that ExRxIndia is also keeping the online physical activities and right? Zoom sessions are also there.
Yes, yes.
Okay. So did you conducted the study?
Yes, yes. I had made a questionnaire and I had forwarded to using the social media.
How many questionnaires you received?
Sir, there were 203 responses I had received.
Okay. So how many are fulfilled? How you categorize it?
So total females were 105 and total male were 88. In which age we had divided in the age groups according to age group. There was 18 to 25, then 26 to 55, and 56 to 85. According to the age group, sir.
Okay. Okay. So what was your conclusion from this study?
So the conclusion was basically that all the outdoor activities were not fulfilled. Like people used to do outdoor activities like walking, jogging, swimming, and all those things were reduced, whereas indoor activities like household activities were increased.
Okay, ma'am. Thank you.
Question from my side. Your questionnaire you made by yourself or any evidence?
No, sir. I had made it by myself regarding like including the day-to-day activities which usually people prefer.
Any type of the survey you are doing? Any type of survey? Any other reference?
No, sir. I had just reviewed the few articles. Like there was one study made in the Switzerland, and even AIMS Delhi it was done, which was similar, which got the similar results.
You taken a similar questionnaire. You some changes in the questionnaire. They are also taking a questionnaire.
No. I did not get the questionnaire from them. I prepared for by myself, sir.
So there is a similar question, or apart from that?
Sorry, sir.
Those questionnaire you are using in your study, it is similar to those your reference. Two reference you are saying one is AM7.
No.
It is separate.
No, sir. Yes, sir.
Okay, thank you, Gauri. We will be moving on to next participant.
Thank you.
Yes, madam. 6 minutes.
Sorry, sir. My PC got hanged actually. So
Okay.
it drank like that.
Okay, madam. Okay.
Yeah. Next is Aisha, as per the sequence. Aisha is there? Aisha
Yes,
Sheikh?
ma'am.
Yeah.
Yes, ma'am.
Kindly join on cam. I'll be opening your presentation.
Okay, sure, ma'am.
Who is presenting? Aisha or
Aisha
Precious?
Sheikh. Next is Precious.
Okay. Both have put 11, that's why.
No, yeah, that is actually due to my thing.
Okay.
ಇದಲ್ಲ ಕ್ಯಾಮ್ ಆನ್ ಕೊಡ್ತೀನಿ ಕೊಡಿ ಉಟ್ಕೊ
Yes, Aisha, madam. Aisha's.
Yes. Can you see the presentation?
yes ma'am.
And can you hear the sound?
Yes,
can
madam.
You hear
Yes.
the sound? Okay.
Yes, madam. Yes, madam.
You can start, Aisha.
Good morning to one and all present here. This is Aisha. My registration number is 11. I appreciate your valuable time and let's move on to the presentation. So the title is high heel complication. As you all know very well that high heel is a self-introductory. So now I am going to discuss the complications of high heels. As you all know, the modern society has been habituated to wear high heels. High heel considered minimum 2.5 centimeter or more than 2.5 centimeter high heel wearers fall more often with heels and they are habituated to fall even without no heels. Now I want to discuss you with the topic of low back pain. Most of the people have complained about the low back pain who use high heels. Body forced to take an unnatural posture to maintain its center of gravity. Change in posture position leads to its pressure and tension on lower lumbar spine. Now I want to discuss you the topic of posture. Before discussing about the topic posture, I want to share my personal experience, a few words about to you. To be honest, I have been habituated wearing minimum high heel. It may pain when I remove my heels. In posture, the high heel increase the experiences of the pressure in cervical and lumbar muscles, which leads to sciatic nerve inflammation due to herniated disc, which has been caused due to altered in posture of the spine, which leads to sciatica. Now, I want to discuss you with the topic musculoskeletal pain. It is a paraspinal muscle. And moving upon to the clinical symptoms or clinical conditions like osteoarthritis, patellofemoral pain syndrome, some muscle fasciitis, heel pad syndrome, bunion, etc. Now, I want to discuss you with the topic of osteoarthritis. Even the high heel has an impact which causes osteoarthritis in our foot and damage the bone and the cartilaginous tissue. Now, I want to share with the topic of patellofemoral pain syndrome. High heel increase the use of the foot. It is very high discomfort level which leads to patellofemoral joint pain and patellofemoral joint stress. Now, I want to discuss you with the topic of some muscle fascicles. In muscle fascicle deformity, the length and the texture of the muscle. Now here I want to discuss you with two muscle deformities like Achilles tendon and gastrocnemius. In Achilles tendon, it is also known as calcaneus tendon. High heel use increase the stiffness in the tendon, which leads to tendonitis, which means inflammation, tendonitis, which means tearing, and tendon rupture, which means break. Now I want to talk you with gastrocnemius. High heel shortens the length of the medial gastrocnemius muscle, especially in the calf. Now I want to talk with you the heel pad syndrome. Before I am going to talk with heel pad syndrome, once again I want to share my personal experience again. I feel a discomfort in my heel when I remove my heels. I feel thickness of my heel pad. Now before talking upon heel pad syndrome, I want to discuss a few points about foot pressure, which increase the pressure leads to metatarsal and the pressure leads to metatarsalgia, which means inflammation or painful. And according to the topic heel pad syndrome, change in the thickness and elasticity of the heel pad leads to inflammation. Now I want to discuss it with vein swelling. The high heel increase the pressure in the vein swelling, which leads to varicose veins. In other conditions, accidental trauma happens more often to multiple areas of the body due to high heels. Now I want to discuss you with the topic of bunions, a deformity of the foot. I conclude let the deformity of the foot fix. Let me conclude with my reference, the Physical Journal and Rehabilitation Center, and the images I have collected from the Google, lost but not deleted, with heels to have healthy foot. Thank you for giving this opportunity.
Yes, before 4 minutes itself, we have finished. Arun sir?
Yes, sir. I was looking what to ask to Aisha. I just one question, Aisha. Did you remove your footwear or not? Still you are
Yes,
using
sir, I have removed.
Still you are using your high heels?
No,
After
sir.
getting lot of complications from the foot to the hip. Okay, so how high heels will cause back pain? You didn't explain any pathomechanisms behind it.
Yeah, when we wear the heel, the heel pad which is we have wearing, it may cause the difference of the heel pad which produces. Yeah.
How you manage your back pain, Aisha? How you manage your
What,
back
sir?
pain? How you manage your back pain? You have got back pain, right? How you manage yourself?
Oh. I will quit my high heel.
Okay. Did you took any hot water or the
Yeah.
IF-10 traction?
At the time of low back pain, we can take ultrasound, hydrophoresis, ice pack.
Okay, Aisha, thank you.
Okay, sir. Thank you.
Pushpendra sir?
No question from my side.
Yes. Dona madam, we can move on. By 11:25, we will give a break, madam. Dona
Okay,
madam.
sir. Yes,
Yeah.
sir. Yes, sir.
Yeah.
Precious? Yeah.
Yes, ma'am. I'm audible.
Okay, I'm opening your presentation.
Okay, ma'am.
Okay, is it visible?
Yes, ma'am. It is visible.
Check the sound is audible or not. Is it audible?
Yes, ma'am.
Okay, Chandramohan sir, can we start?
Yes, madam.
Good morning, everyone. Myself Precious, and my register number is 11. And the topic that I have selected for my poster presentation is effectiveness of birthable exercises to reduce labor pain, which is a literature review. So, coming to the introduction, the birth ball, as we all know, it is also known as a fit ball or cis ball. It is a large ball that provides a soft surface for women to do the exercises, especially during the time of the labor. So nowadays, the women in labor are aware of the frequent adverse effects of pharmacological analgesia as well as the healthcare costs and their complications. So nowadays, they're seeking for the non-pharmacological pain relief methods. So the physiotherapy have introduced a group of exercises known as perinatal exercises to reduce pain the pain during the time of labor. So one of the among that one exercise is birthable exercises, and it will directly relieve the woman's labor pain by improving the pelvic dimensions, mobility, and as well as the fetal positioning. So coming to the objective, my objective for my study was to review the published literature on the effect of the birth ball in labor pain relief management. So I have included 11 studies with the 4 RCTs, 2 systematic reviews, and 5 experimental studies from the year of 2011 to 2020. And the databases that I have used was Google Scholar, PubMed, and Cochrane database. So out of the 11 articles reviewed, all the articles they proved that birthable exercises such as pelvic rocking, bounce, ball squat, and resting frog squat, it helped in relieving the labor pain. And they also commented that the use of birthable is safe and it could promote comfort, relaxation, reduced anxiety and pain during the labor. So the birthable exercises, it mainly depends upon the mechanism gate control theory, thus by providing the support for the perineum without applying any significant pressure. So the freedom of movement and upright positions on a birth ball during labor, it will assist the gravity to facilitate and enhance the fetal descent, and thus by improving the quality and effectiveness of labor contraction and thus by decreasing the labor pain. So my study was concluded that clinical implementation of birthable exercises during the pregnancy or at the time of the labor, it will be an effective adjunctive tool to improve the childbirth self-efficacy and thus by reducing the labor pain in women. Thank you so much.
Very good article, Precious.
Thank you so much.
So how many articles you have taken?
So I have included 11 studies, sir, which 4 RCTs, 2 systematic reviews, and 5 experimental studies.
So what are the difficulties they have identified in these articles?
So the few of the studies they have out of the 4 RCTs, 2 RCTs they have included on the primiparous woman. So according to the labor pain, the severity of pain will be different in multiparous as well as the primiparous woman. So few of the studies they have included on the primiparous woman. So the pain severity, how much it will decrease, that is still a controversy, sir.
Why this ball exercises raise a significant improvement in reducing pain?
Sir, I didn't get it.
What is the mechanism behind it?
Sir, it is control theory, sir. It is like we will apply a non-painful massages to the painful areas. So this by it will act mainly on the sensory discriminative component of pain. Thus, by blocking the part of the nociceptive message in the pain. So that's by decreasing labor pain. So the gravity will help to relieve the labor pain, sir. That more contractions they are getting, the pain will be very less, sir.
Thank you. Thank you.
Yes, sir.
Pushpendra sir.
Yes, sir.
Hello.
Hello.
Yes, sir.
Yes, please. Yes. No question from my side.
Sir, okay, sir. Thank you so much.
Thank you, sir. Thank you, Precious, and we will move on to the next candidate. Tuna, madam.
Yes, sir. Opening for the next one.
Yes.
Number 12.
Is number 12 available? Hi.
Nikita, is there?
Ma'am.
Yeah.
Yes, ma'am.
Okay. Okay, you can see the presentation, right?
Yes, ma'am.
Please start.
Please start, Likita.
Okay. Good morning, everyone. My name is Likita. My register number is 12, and my topic is effectiveness of Nintendo Y balance board exercise program on standing balance of children with cerebral palsy. A literature review. Introduction.
Okay.
Cerebral palsy is a most common childhood movement disorder with a prevalence of 2 to 2.5 per thousand live birth per year worldwide. A common clinical problem in individuals with cerebral palsy is impaired balance. The Nintendo Y balance and its peripheral balance board have been proposed as a training tool to improve the standing balance in children. The Nintendo Y is a subset of virtual reality technologies known as active video game. Objective of my study is to search literature on program on standing balance of children with cerebral palsy. Methodology. A literature search was done using Google Scholar, PubMed, Cochrane database to find out relevant studies from the year of 2013 to 2020, describing different Nintendo Y balance board exercises. 16 are studies which included 12 randomized control trials and 3 systemic review and 1 experimental study were reviewed. And inclusion of the study was patient with neurological patient with level of 1 or 2 gross motor function classification system and mild cognitive impairment or no impairment. And the exclusion of my study was patient with neurological disorder or epilepsy or associated impairments like hearing or visual impairment, or who are received botulinum toxin. And result of my study was the outcome of 6 out of 16 article reviewed. All articles proved that Nintendo Y balance system is effective at improving functional performance by enhancing flexibility, balance, strength, and coordination training. The additional advantage of the Nintendo Vibe system is the visual feedback that the participant received during the training session. Discussion of my study. The study demonstrated that balance and mobility training at home using the Wi-Fi in children with cerebral palsy is feasible and safe, and that parents and children's rating of satisfaction was high. The Wi-Fi game required the children to stand on balance board and shift weight, march on the uh, squat, march on the squat, or step up and down of the balance board forward, backward, or sideways. The clinical outcomes demonstrated that Wi-Fi training has the potential to improve the lower limb strength and walking. Conclusion of my study. The study concluded that Wi-Fi balance-based video game rehab are important components of CP rehabilitation on balance parameters and independence level of activities of daily life. The Y-based training is more safe, fun, and provides motivation and may be preferable method of treatment of child. Thank you.
Thank you.
Thank you. Nikita, so what type of cerebral palsy did they took it in your studies, all the studies?
Sir, hemiplegic and spastic diplegic CP.
Is there any mentioning about the age group for the studies mentioned there for the cerebral palsy children?
7 to 14 years, sir.
So what are the inclusion criteria they have, or what are the inclusion criteria you have created to include in the articles?
The gross motor function classification system is level 1 and level 2, and mild cognitive impairment or no impairment. Or the patient have to need sufficient balance to play the game with sitting or standing.
So how this Nintendo helps in improving the balance and the gait?
What's
How this technology improves balance and gait in children? What's the mechanism behind it?
Have you got the question?
Yes, sir.
Yeah, please. What is the mechanism behind it? How it helps in improving?
So the child need the sufficient balance to play the game, and functional. They need the skill to hold the remote and all, and follow the commands.
Yeah, thank you. Thank you.
Thank you.
Spencer?
Yes, one question from my side. And you explain in your balance board, it is improving the gait. So in this board, the patient or cerebral palsy child is walking. Yeah, it is standing in the one place.
Yes, sir.
No, it is standing in the one place or it is walking.
Standing in one place.
Okay, so what theory behind that it is improve the gait? It is only the visual feedback system or it is another thing?
Visual feedback system.
Only visual feedback. So you can suppose that the patient or the person is standing in one place, we improve the gait. It is a what type of theory in your article is revived? You have any idea? I'm audible,
No.
Nikita?
Yes, sir.
Thank you.
Thank you, sir.
Thank you, Nikita, and thank you, sir. Arun sir, can we go for a break now?
Yes, sir.
Yes, we will take 15 minutes break and 5 minutes for rejoining. Totally 20 minutes we can take a break. Pushpendra sir?
Yes, sir.
We will have a 20 minutes break time, sir, 15 to 20 minutes.
Okay.
Then we will rejoin. Yes, dear participants, you can either Duna madam, can you leave
stay
the
connected. You can stay connected and just keep it muted.
what
Take
about
a break and come back.
what about YouTube, madam?
It will run, sir. I cannot do anything.
Okay.
You
We
can just
craft.
put a message there, sir.
Yeah, dear viewers, we are taking a 15 or 20 minutes break. We will be joining. In case if you are watching, kindly stay tuned for the next 15-20 minutes. Duna madam, we can play some songs meantime.
Okay, sir.
Yes, sir. We will meet by 11:45.
Sir, I cannot play any music. There will be copyright issue in YouTube.
It's okay, madam. We will handle that. No issues.
You want me to play songs?
Yes, madam.
Okay.
Any songs, Tamil, Hindi, anything.
Okay, I'll be playing something Tamil for you.
Okay.
कहीं दूर चले जाए हम, कहीं दूर चले जाए हम, दूर इतना कि हमें छू न सके कोई गम। कहीं दूर चले जाए हम। फूलों और कलियों से महके हुए एक जंगल में एक हंसी झील के साहिल पे हमारा घर हो। मैं तुझे प्यार करूं मेरे सनम, तू मुझे குளிர் கொஞ்சம் தருமா தருமா கனவென்னை களவாடுதே. இது என்ன முதலா முடிவா இனி எந்த உயிரும் உனதா புது இன்பம் தாலாட்டுதே. கேட்டு வாங்கி கொள்ளும் துன்பம் கூறு போட்டு கொள்ளும் இன்பம் பர பர பரவெனவே துடி துடி திடு மனமே வர 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 கரை தாண்டிடுமே.
Yes, Duna madam.
Yes, sir.
Yes, Arun sir has joined. Pushpendra sir there?
Pushpendra sir, are you there? I cannot find him in the list. What a message for him, sir.
Yes, sir. Hello.
Yes, sir.
Yes, sir.
Hello. Here on the phone.
So happy birthday.
Has he joined?
He is joining, sir. He's joining. No, not yet.
So you want to surprise him, Chandra?
Not like that, sir. We are enjoying the break actually, and meantime, suddenly I thought, let me greet him with the slide when he comes back.
He's coming.
Yes, that will be nice because he is spending his birthday with us, so he should not feel bad. He should have a happy day also.
Welcome back, Pushpendra sir.
Sir, ExRxIndia wishes you a very happy birthday once again, and we welcome you back.
Can you hear us, Pushpendra sir?
Kindly check his audio.
Hello.
It is open, sir.
Yes,
Pushpendra
sir.
sir, can you hear us? Yes, we can hear you. Hello? Yes, speak something, sir.
Hello.
Yes, sir. Can you hear us, sir? Pushpendra sir, can you hear us? Sakshi, can you please mute? Pushpendra sir? Chanamo sir, you can hear me?
Yes, madam. Yes, madam.
Sir, can I share the participants' screen?
Yes,
sir?
yes, yes, madam.
It's the term for 13th,
I'm
right, sir?
audible?
Yes, sir. Very much. Very much. Once again, we wish you, ExRxIndia wishes you a very happy birthday and we welcome you back, sir.
Is the screen visible, sir?
Yes, madam. Can we start?
Sir,
Pushpendra sir?
wait, sir.
No, just I'm just asking him. Sir, are we audible, sir? Pushpendra sir?
Start.
Am I visible, sir?
Yes.
Okay.
Akhil, please.
Kindly tell me if you can hear the sound.
Yes, I can hear the sound.
Can you hear the sound?
Yes, madam.
I can. Yes, ma'am. Can hear.
Okay.
Yes, you can start.
Can we start, sir?
Yes.
Okay, thank you, sir. A very warm good morning to one and all present here, respected faculties, judging panel, and my fellow delegates. First of all, thanking God the Almighty and the ExRxIndia team for providing such a wonderful platform for present poster. My poster presentation topic is the efficacy of SCROT 3-dimensional exercise program in treating an adolescent idiopathic scoliosis. It's a case study. I myself, Akhil, register number 13. Background of the study: scoliosis is the lateral curvature of the spine in the upright position. In the clinical settings, the corpse angle analysis method is generally used. Minor scoliosis with less than 20-degree corpse angle requires a periodic observation, and scoliosis with a corpse angle of 20 to 40 degree requires a wearing of an orthosis to prevent progression. Scoliosis cause of deformation of the spinal cord and associated structures decreases in the spinal flexibility by changing the characteristics of erector spinae muscle, leads to imbalance of the trunk and pelvis. SCROT method involves pelvic correction, lengthening of the spine, performing corrective breathing exercise, and tensing the trunk muscle to maintain correct posture. Objective of the study to determine the effectiveness of cross three-dimensional exercise to improve corpse angle, vital capacity, and reduce pain of a female patient with the right side idiopathic thoracic scoliosis. Methodology: subject performed the squat exercise 3 times a week for 12 weeks. At the time of the exercise program, both pre and post tests were taken. The equipments used for the treatment program was doorway chin-up bar, gait belt, wooden poles, TheraBand, soft gym ball, SPRI band, foam rolls with the holes and TheraBands, exercise board. Squat three-dimensional exercise is based on sensory motor and kinesthetic principle. Outcome measures used were visual analog scale, corpse angle, and spirometer. Case description: a 17-year-old female high secondary student is diagnosed as a right side idiopathic thoracic scoliosis whose corpse angle was greater than 25 degrees. Chief complaints were difficulty in breathing that interfered the sleeping pattern and pain. Coming to the result part, the patient in our study had corpse angle decreased, vital capacity increased, and pain on visual analog scale also reduced. And these are the value interpretations. The pre-test of vital capacity 3.2 liters. After 4 weeks, it had improved to 3.6 liters. After 8 weeks, 3.9 liters. After 12 weeks, 4.1 liters. And coming to the corpse angle, the pre-test value was 26 degree. After 4 weeks, it had improved to 24. After 8 weeks, 21. And after 12 weeks, 20 degree. On visual analog scale, the pain was at the pre-test time, it was 8. After 4 weeks, 6. After 8 weeks, 3. And after 12 weeks of treatment session. Coming to the conclusion and implication part, the efficacy of the squat three-dimensional exercise has shown a significant improvement in patients' corpse angle and decrease in vital capacity and pain and visual analog scale reduced. Thank you, sir.
Thank you. So I just want to ask you one question.
Yes, sir.
Is it postural scoliosis or some acquired scoliosis?
Sir, it's a structural scoliosis.
So structural scoliosis. Okay.
Yes.
So how about the improvement was there? How long it takes for the improvement?
Sir, the study was 12 weeks, sir. 12 weeks of study.
Okay.
And in between every 4 weeks, we had done the test of the values of vital capacity, corpse angle, and pain. But each week there was improvement, sir. After over 4 weeks, there were significant improvements, sir.
So you are able to identify the weakness, improvement.
Yes,
so
sir.
Improvement where you measure using an X-ray or other type of measurement you have taken?
So using the X-ray method, sir, corpse angle, and vital capacity by using the spirometer, sir, and pain by visual analog scale, sir.
Why you want to expose a patient every week in X-ray?
So as to see the difference.
Either you can take in a first week, 4th week, 8th week, right? Why you are frequently exposing the patient for X-ray?
So by the radiological imaging, we can see the specific change, sir. So that's why.
Okay. Thank you very much. It was nice.
Thank you, sir. Thank you, sir.
Pushpendra, sir. Pushpendra, sir. You have to unmute, I think. Yes, sir. Any questions?
Pushpendra, sir, you there?
Sir, any questions? Pushpendra, sir. Okay, we consider it as no questions. Then we will move on to the next.
Thank you, sir.
Sir, kindly check. Okay, he is having not sent a message, not audible. Okay. Yes, we can move
sir,
on to the
can you
next.
rejoin?
Pushpendra, sir, can you rejoin? Send a message, madam. Send a message in Zoom chat. I will also send a message in WhatsApp.
Yes, he is rejoining. Sir, can you hear us now? Audio connecting, not yet connected.
Okay. We will wait for a minute, Arun sir. Kindly pardon us.
No problem, sir.
Yes. Is he there, madam? Has joined? Is his audio connected?
He has joined, audio connected. Sir, kindly unmute Pushpendra sir. Audio disconnected again, sir.
Maybe he's having poor connectivity.
Poor audio connection, sir.
Okay.
Now audio disconnected.
Okay.
Disconnected now. Sir, can you unmute, please? I have sent you unmute request, sir.
I will call him. Okay, just a moment.
Sir,
I will
kindly call.
He's saying we can start next.
Okay.
Yeah.
Next is number 14, Sneha Tiwari and Dr. V. Gadalakshmi. Kindly join in cam. I will be opening the presentation for you.
I'm ready, ma'am.
Okay. Kindly inform if you can see the presentation.
Yes, madam. We can see.
Can you please play it? It's just a PDF.
Which one is the GIF? Playable?
The down one, ma'am. It will be played in PPT presentation.
Yes, it is presentation.
Yeah,
But
this is a
nothing
PDF file. This is a PDF file, ma'am. I have sent you the PPT slide also. In that only it will be played.
It is not playing.
Yeah, this is a PDF file. One more, I have sent you the link. That is my PPT link. So.
Wait.
PPTX.
Yeah, PPTX.
Wait a minute.
Pushpendra sir, by the meantime, we will check his audio. Pushpendra sir? I think. His audio is connected.
Yes, but he's being unable to unmute, I think. Yes, Neha, I have got your PowerPoint presentation. I'm opening it right now.
Yes, ma'am. Yes, ma'am. Thank you.
I hope it will work. Yes, many GIFs are there.
Yeah.
Can you see it? It is presentation only, PowerPoint.
Are you able to click on the slide show, ma'am?
Yes, yes.
Yeah. Yes, ma'am. Now I can see it, ma'am.
Okay. And check if you can hear. You can hear, right?
Yes, ma'am. Ma'am, just share to the slideshow so that, yes, ma'am. Okay, ma'am, I'm starting. Good morning, everyone. My name is Neha Tiwari and my guide name is Dr. Varalakshmi, ma'am. And the theme is recent researches of advancement in physiotherapy practice. So my title is on Cardio Cage, a new techno device for enhancing the multisensory reflex training in athletes for improving the sports specific performance. My registration number is 14. So the purpose of my e-poster is to discover the new training system to improve the sport specific performance using the 360 multidimensional device known as cardio case. The introduction is that the sports that involves a dynamic environment typically requires the high perceivable ability for athletes to execute the motor skills. As we know, the reaction time is important matter to study a person's center information processing speed and coordination peripheral movements response. If the athlete is able to react quickly, then their opponent on a critical game-changing place, then their odds of defending the opponents are greatly increased. The equipment is a cardio cage where I'm using for the reaction time, agility, coordination for the athletes. The growing practice of the sports vision training rely on the notion that the practice with the demanding visual perception, cognitive or the oculomotor task can improve the ability to perform and respond to what is seen, thereby improving the sports performance. The cardio cage is a smart sound-based reflex training system that bring an element of the competitions to workout, thereby offering a fun way to improve the endurance, agility, balance, coordination, reaction time, and strength. The method of training is that if you see the GF, the video, the player stand in the center of the arena with the objective of hitting the target as they lights up. So the reaction time is shown at the end of the section along with the total number of targets that were successfully hit out of the total number of targets. So during a section, the cardio cage, the player must twist around and face the various lights as well as to move up and down to reach the different level of light. This movement along with the light, sound, which heightens the sense as what brings about enhance the physical and mental performance. If you see the down video, we have a cage, we have different sort of light, the player is inside. So, and everything is operated on the phone. So we can customize the phone and everything is noted in the phone. If you see the advantages, it's a fun and innovative. It is the first system to deliver the workout through the phone. It challenged the athletes to smash, it's activate the cognitive stimuli based on the training specific needs. The conclusion is it's a creative way of enhancing an athletes to improve a specific performance in terms of reaction time, speed, agility, concentration, balance, awareness, and coordination. The scope of my research is that this is not only used for the athletes, it can use for the other patients or other kind of conditions also. For example, at workplaces to improve the performance of employee, in school to improve the performance of student, in the neurological conditions such as to improve the balance and coordination by modifying the equipment, such as in Parkinson's, stroke, and etc. To improve the reaction time and attention span in ADH children's like attention deficit hyperactivity disorder. The down are my references. So here everything is operated through the phone and you can customize all the activity through the phone. And to modify for the neurological condition, we can only use the pods. With the pods, we can give them the training. Hello, sir.
Is it over?
Yeah, sir.
Yeah, okay. Yeah, the cage you are selling, right? Is how was the cage? Wherever we can fix it at the cage.
Sir, the recent days I did a research on the brace pod. So here it's a new technology, sir. So the pods are into the cage. So the cage are so portable, you can set the cage wherever you want, and we have few sense cameras in that. So I have an app in my phone, and I will with the specific needs of athletes, because few member wants to increase the agility. for each and every sports, the important thing is the reaction time. So for that, I have a specific setting in my phone. So I'll set according to that. The lights blink. With the light, the sounds comes. So with that sound and light, the athlete need to touch and smash that thing.
Okay.
So recently, few months back, sir, I did a research on brace spot. If you see in that in my presentation, you have a small light spots.
Yes.
Yeah, so I did on the concussion patients, sir, the post concussions, because they say the research say that they have a reduced reaction time. And now, if you see in the sports journal, the reaction time is for the best reaction time is 0.17 seconds for male and 0.21 seconds for female. Hello.
Thank you very much. Thank you.
Okay, sir. Thank you.
Pushpendra, sir. He is having some network disconnectivity. So he said that he will be rejoining. Let us check.
He joined, sir. He's there in the list.
Okay. We will call him once. Sir, Pushpendra, sir, are you able to hear us? Yes, we consider there are no questions from his side, then we will be moving on to the next participant.
Okay, sir. Thank you, sir.
Yeah, he is able to audible. Yes, sir. Please take 5 minutes. No issues. Sir.
Should I go for the next, sir?
Yes, madam.
Okay. Next is number 17, Niranjan Meena. Is he there?
Niranjan is there.
Okay. Is it visible?
Yes, madam.
Niranjan, kindly join cam and you can start.
You can start, Niranjan.
You are not audible, Niranjan. Speak something.
He is not hearing us, I think.
We cannot hear you. Try without headphone.
Remove headphone and speak. Remove
Speak
headphone.
something.
Okay, I request registration number 18 to go. Next, we will look for the Niranjan's presentation. Duna, madam?
Niranjan.
Meantime, I will call him.
Okay.
Yeah,
then
please.
I am stopping screen share.
Yeah. Niranjan, call me. Niranjan, you can call me. Make a call, please. Yes.
Next is number 18, Sakshi. Sakshi there?
Hello.
Yes, sir.
Niranjan, நீங்க பேசுறது கேட்கலப்பா.
Sakshi, can you join cam? Check if the slide is visible for you.
Duna madam, he is requesting that after 3 or 4 slides, he will be presenting because his mobile got so much of heat. So it's not out.
Okay. No problem. We can do that. Slide is visible, right, sir?
Slide is visible, madam.
Okay. Sakshi, please start. You are not audible too. Sakshi? Try without headphones, Sakshi. You are not audible.
Disconnect.
Chandramohan sir, can you hear her? I cannot hear her.
No, I'm not able to hear her. Shakshi, you just disconnect the headphone from your device. It's not like removing headset. Shakshi? Who is 19? Okay, she is asking for 2 minutes. Okay.
So we can go for next step.
Next one. We can go for next one.
Christy is the next one. Christy.
19. Who is 19?
Sir, myself, sir.
Yes, please. Yeah. Your audio is clear and yes. Came on.
Kindly wait. I will be opening her file.
Yes, ma'am. Sure, ma'am. I am audible, sir.
Yes, madam. Yes, madam.
Yes, sir. Thank you, sir.
Is it visible?
Yes, madam.
Okay. Christy, you can start, please.
Yes, ma'am. Sure, ma'am. Good morning to everyone, dear students and everyone who are hearing me. Good morning to everyone. My e-poster is about technology and physiotherapy. According to Bill Gates, I'm going to start with a quote from Bill Gates. He said, "We are changing the world with technology." So my topic is technology, which is an important vital tool. Have to incorporate in physiotherapy, starting from the education or clinical practice until the rehabilitation protocol in our thing. Next, the technology, a small definition about that. It's from a Greek word technique, skill, art, or craft. And next, I'm going to tell about the artificial intelligence, which is an emerging field, a modern one, which gonna a future in all the fields. Artificial intelligence is a development of technology which is used to perform the technological operations requiring involvement of the human intelligence. It is artificial intelligence is the machine doing the work what our brain thinks. The artificial intelligence are of two kinds. One is the software and another one is the hardware interfaces. The softwares are emerging more and more in physiotherapy. Some of the artificial intelligence and physiotherapy softwares were the predictive modeling for the exacerbation of asthma. They have predicted the acute exacerbation of asthma using the artificial intelligence, and the second one is the stroke recovery predictor. These two softwares are used more often as an artificial intelligence software in physiotherapy. And the next one is the assessment of posture by open pose. It is a new software which is developed in our country, India. The video of the patient or the sportser is inserted into this software, and the open page will get the data and it refine and it give the interpretation like our human brain thinks. The assessment of posture by open pose, it's used in the sports person, especially in the basketball players, in order to analyze their posture while throwing ball and all. Next, I'm going to tell about chat box system, which is a cognitive therapy. Which is used by the physiotherapist in this COVID pandemic in order to know about the emotional status of the patient. Next is a cerebrotech wizard, which is used for stroke detection, and it has a 92% accuracy of detecting the stroke.
the virtual reality and the augmentation therapy, which is a type of ExR games, which means an exercise plus gaming we are giving to the patient for the betterment. Virtual reality is the creation of an artificial environment, and the augmentation therapy is the augment of real life scenes. These two shows an level 2 evidence in many of the cases like Parkinson's and CP children's and many conditions. Next is the aerotrim, which is a multi-axis rotator, which is used for the cardiovascular training and equilibrioception for the pilots and astronauts. Next is the telerehabilitation, which is a wide one we are using now in the COVID pandemic. The rehabilitation is a very act of restoring the someone to health, and it is done through the online mode. The telerehabilitation, there are many articles and literatures coming about telerehabilitation in many conditions like muscular dystrophy and the Parkinson. Mainly the telerehabilitation concentrates on the neurodegenerative conditions where the follow-up, lack of follow-up will worsen the conditions. Next is bionic hand. Bionic hand, now the recent trend is mind-controlled bionic hand has come, which is a recent advances. The electrode will be placed at the end of the stump for the amputated patient, and it will give the feedback to the brain and it will activate. Next, the exoskeleton and the body weight supported treadmill testing exoskeleton. Next, the wearables and the anti-gravity treadmill, which is used at many fracture patients and all, and it has a low-level evidence. Next, my last one is the multimodal approach. Multimodal approach means we cannot use a technology as a separate one. In the physiotherapy, we can combine 2 or 3 technology as a one to give an effective treatment. Like as in the diagram, it's virtual reality with the robotic hand. The virtual reality gives a feedback to the patient in order to how to the robotic hand should act. Next, an activity and mobility using technology amount is a study done at Australia by the physiotherapists over the aged care populations, and they use the virtual reality wearables for the follow-up in the old age people during this COVID pandemic, and it showed the better result. As a conclusion, technology is
Thank you.
sure, sir. Thank you, sir.
It's a very good, innovative topic actually. As the other professions, even though when we compare to medical profession, physiotherapy are very least technically advanced, I will say that. One thing is because of cost effective, we are not able to buy the technologically advanced equipments or the wearables because it is very much costly and patient was not able to afford it. That's one of the reasons why we are not advanced to it. So what is your conclusion on this? Please conclude what you are trying to say.
Yes, sir. Technology can do, a machine can do a work of an 50 extraordinary man, but it cannot recompensate one extraordinary man's work. That's my conclusion. Physiotherapists should include the technology also in order to improve the betterment and the patient care, and also for the follow-up they can use. Technology alone is not an one. We have to incorporate that in our practice. That is my conclusion, sir.
However equipment you have, you need to switch on, right?
Yes, sir.
Human has to switch on.
Yes, sir. Yes, sir.
Yeah, thank you, Christy. Thank you.
Thank you so much, sir.
Pushpendra sir, are you there? Okay, we consider no questions from him. Thank you, Pushti.
Yes, sir. Thank you, sir.
Sir is joining now. Pushpendra
It's okay. It's okay. It's okay. We can move on to the next. He will be taking care of it. And who is next? And till 25, be ready. It means that we don't have participants from 1, 8 like that. So morning we are going to have 20 presentations. So far we have finished 15. That's going to be the 16th and another 4 participants. Please be ready.
20, Divya Gohil. Is
Yes.
she?
Yeah, ma'am.
Okay. Kindly wait. I'll be opening your presentation.
Okay.
Can you see?
Yes, ma'am. Yeah. Shall I start?
Just a moment.
Yeah.
To make the bill ready.
Yes, madam.
Yeah.
Able to hear.
Good morning, one and all. My today's topic presentation is about matrix therapy for low back pain, and my QuESTCON poster presentation number is 20, and my name is Divya. So, starting with the low back pain and the matrix therapy. So, everybody know about the low back pain. So, what is the condition and how it starts? So, we know that it is globally the prevalence rate of the low back pain is 70%. And the symptom varies from mild back pain, mild muscle spasm, to radiating pain. And moreover, if the condition worsening, then it can have a radiating symptom stenosis. And sometimes the person needs a surgery on a very emergency basis. So we know about the basic, what are the pain culprits of the low back pain, and we are moving to the digital spinal assessment. So if we wanted to do the basic spinal assessment or the low back pain assessment, so what are the traditional approaches we do have? That we have the medical assessment, we have X-ray, MRIs, and we have a physiotherapeutic assessment also. But nowadays something new, that in a recent advances, digital spinal assessment, which gives us a segmental level mobility of each spine, and it can be recorded on a computer also. So in that way it has a new approach. Then talking about the matrix therapy, so in the image I have shown the matrix therapy's inventor, Dr. Randall. So according to him, matrix therapy is working on a cell. So for each condition, what is the derailment procedure, or on any condition, if we are working on a cell, that is the root cause of any pain, any condition, any deformity, or any pathological condition. So if the root cause can be treated, then the automatically disease can be treated. So same how the matrix is working on the same. And if we look into the mechanism, then it says that the normal cellular vibration is skeletal muscles is varies from 8 to 12 hertz according to his researches. So whenever there is a imbalance happening at the cellular vibration, or whenever there is a imbalance happening at any other cellular movement, so what will happen? There would be a reduction of the intracellular and extracellular movement, and ultimately it will have an impact on an ATP synthesis. We know that ATP is the main source which generating the energy, and reduction in the ATP will lead to the reduction in the oxygen. Deprivation of oxygen can lead to the shortening of the muscle, tightness of the tissues, deformity, and we know what are the further procedures. So if we directly working on a cell, if we regularizing the cell, then it can releases the tissue release, it can release, person can relieve from a pain, we can improve the range of motion, and we can not indirect way, but we can directly working on a cellular level on a root cause. So person may have a long-term effect rather than the short-term effect. So this is all about the matrix therapy. And if I consider about a research, so I have done my pilot study. So out of 15 participants, I have completed 12. So 3 more participants are yet to be completed. But if I have checked the data analysis of the 13 participants, so the result of the matrix therapy on a pain that has been taken by the NPRS scale, flexibility has been taken by the osmometric questionnaire, and the mobility, that is gross and the segmental. Gross has been taken by the normal physiotherapeutic assessment we take, and the segmental I have taken from the spinal assessment, and the results are amazing, and patients are really very satisfied with that. But still there are 3 more patients to be complete for my study. So I think this is a new approach which we can work on a physiotherapy field. So not only the low back pain, we can consider, or we can treat, I think, all kind of conditions, including the neurological, including the orthopedic and the cardiovascular, because there has been a study also which also suggested that has been done by the Faru author, and it says that there has been shown an improvement in the arterial dilatation, and the outcome measure also was the medical outcome measures. So it has been shown that matrix rhythm therapy also working on the not only the cellular level but the arterial level, and it has been increased the dilatation of arterial structure. So in that case, I think it is really a new innovative we can approach or an approach we can apply for every condition and for all kind of muscular, ortho, and neurological condition. That is all from my side. Thank you.
Yes, 5 minutes over.
Thank you, Divya.
Yes, sir.
So you have taken 15 as your pilot study. You are able to complete 13, right?
Yes, sir.
Will all the type of low back pain do you choose, or any specific criteria you have chosen?
Yes, sir. I have chosen the ethical committee has been also done for my pilot study, and inclusion criteria. I have taken the chronic low back pain patient and those patients, those who are having a MRI. So we can see that those who are having a lumbar disc prolapse. So according to the orthopedic suggestion also, it has been said that if a person is having a disc prolapse and if the matrix is working on a prolapse level, then it can be a really new inventive, and we can really prevent the surgeries, and we can also prevent the severe cases which can go up to the disc extrusion or sequestration and likewise.
So what the matrix rhythm therapy does in the low back pain? How it reduces pain, or how it reduces discal pain?
Yes, sir. So, sir, according to the matrix, I have done the advanced workshop also. So there are basically two techniques, involution and extrusion. So in that, we have to focus on the lumbar plexus first. So that is the central area where the pain starts. That is the disc region. So we have to focus on the disc region first, and we can cover the peripheral region also. Like if the person is having a radicular pain in the calf region or in the hamstring region or in the anterior aspect of the thigh, that is the femoral pain or femoral nerve injury or anything. So we can also give matrix over the entire leg. So on the first day, it total duration consists of 60 minutes. So we can divide the total minutes, and we can for 15 minutes we can focus on each region.
Thank you very much, Divya. Thank you.
Yeah, thank you so much.
Good presentation. Thank you.
Thank you, sir.
Pushpendra sir, are you there? Okay. Madam, we can move on to the next part.
Yes,
thank you.
Okay, sir. Thank you.
This is Rashmina.
And those who
Is
missed
the slide visible?
Those who missed the last two persons, they can join at the end as 19th and 20th.
Hello, am I audible?
Is the slide visible? Yes, you are audible, Rashmina.
Yes.
Your audio is a little noisy.
Is it okay now?
Yes, better.
Okay.
Can
So
we
good afternoon,
start, Salman sir?
Yes, madam.
Yes, okay. Good afternoon, everyone. My registration number is 2021-001-0021, and the title is Gluteus Medius Strength in Normal and Overweight Young Females. The background and purpose of the study is the gluteus medius is the primary muscle that acts as a hip abductor and a pelvis stabilizer in a unilateral stance against gravity. The gluteus medius weakness can lead to lateral hip pain, iliotibial band friction syndrome, patellofemoral pain syndrome, and osteoarthritis of the knee. Maintaining the strength of the gluteal musculature can be very challenging for the obese individual due to overweight. Both overweight and obese people suffer from metabolic effects of adipose tissue on the muscular system, a decrease in anabolic hormones such as growth hormones, and an increase in pro-inflammatory cytokines alter muscle metabolism. The cytokines produced by visceral fat causes degeneration and a reduction in skeletal muscle quality. So it is very important to assess gluteus medius strength in obese individual in clinical practice, as weakness in this muscle is associated with not only biomechanical changes but also musculoskeletal system.
The objective of the study is to compare gluteus medius strength between overweight and normal young females using push and pull dynamometer methodology. A convenient sampling was done and 40 young females were taken of age 18 to 24 years. 20 normal and 20 overweight females were included in the study. Exclusion criteria were orthopedic disease, pain or weakness in the lower limbs, pregnancy. The push and pull dynamometer was positioned 5 cm proximal to the knee joint line. The samples were positioned in lateral decubitus with slightly extended hips. The examiner applied then a resistance force downwards and samples were asked to exert a maximum force against it for 5 seconds. 3 trials were made and highest value was taken for the study. Result, the data was analyzed to compare the gluteus medius strength in normal and overweight young females using independent sample t-test in SPSS version 16. The results showed that overweight have greater gluteus medius strength than normal weight, where T is equal to -4.36, p-value 0.0144 for right side, and T equal to -5.06, where p equal to 0.000 for left side, which was statistically significant. The discussion, this study is in agreement with many studies like study by Lerner et al. Which reported subjects who are obese have greater gluteus medius strength during gait, and its correlation with an increased BMI reflects the theory of overload adaptation, but there was no difference in the gluteus medius strength between groups in the study by Fenato et al. Present study suggests that gluteus medius of obese generate higher strength, where increased muscle strength could be described as a beneficial adaptation to obesity, with excess body weight acting as a chronic training stimulus. The conclusion of the study concluded that the strength of gluteus medius is seen more in overweight than normal weight young females. So these are my references.
So, very good evening, Rashmina, and it was a good study.
Yes, thank you, sir.
So you are telling that obese is good, right? And compared to the gluteus muscle strengthening.
It's not like obese is good, but then in obese and overweight, the strength of the gluteus medius is seen to be good. So that we can inculcate this idea we can incorporate in our treatments. Like for a normal weight individual, we can ask them to wear some kind of vest which weighs like like 7 to 8% of body mass, and that vest we can ask them to wear from morning to evening. So that will act as a stimulus, chronic stimulus to the body, and that can eventually increase the quality of the muscles, sir.
Maybe you have done with very small population. Maybe when you are going for a higher population, maybe you can find some differences.
Probably, sir. That can be my limitation.
Probably you have to go with the higher population, your post graduation or your scholarship exams. Yeah, thank you. It was new information for everyone. Thank you.
Okay, thank you, sir.
Pushpendra sir has joined.
In this session, I have not listened carefully and completely, and I'm joined in a minute. So I'm asking the next presentation.
Yeah. Okay. Yes, sir. Okay, sir. No issues.
Thank you, sir. Thank you, everyone.
For scoring, sir, you just kindly go to later the break time. We will be having a lunch time. That time, just go through the video and just put the scores, sir, about presentations and all those things.
Yes, the video is available in YouTube. Thank you, Rashmina. You can switch off your cam. Yes.
Who is next, madam?
Next is Sheikh Imtiaz. Sheikh Ummi Swada Imtiaz.
Hello.
22.
Yes, ma'am.
Ma'am, I think
may I audible?
Yes, Arun sir.
The 2% are missing, right?
After this, sir. After
they will be doing at the end, sir, of the morning session.
Sakshi and
Yes.
Niranjan.
They are waiting this, please consider.
Yes.
Sir, can I share screen for Imtiaz?
Yes.
Is it visible?
Yes, madam.
Yes, ma'am.
Yes, you can start.
Okay. Good afternoon, everyone. My name is Sheikh
Are you
Sauda
audible now,
Imtiaz.
Donna ma'am?
Kindly pardon. Sheikh, please stop. We will restart it.
Yes, you are audible.
Okay.
Yes, sir.
Okay,
You are
okay.
audible.
Again, yes, sir. My system is okay now. My laptop is some disturbances here. Some keys press. Now it's okay. I'm joining again on my laptop. Okay.
Yes, yes, sir.
Start.
Yes, sir. Thank you.
Start,
Yeah.
Sheikh.
Yes, Sheikh.
Okay. Good afternoon, everyone. My name is Sheikh Sauda Imtiaz. My registration number for e-poster is 22. My topic is effectiveness of aerobic exercise in PCOS among obese women. Background and purpose. PCOS is a complex endocrine disorder affecting the 5 to 10% of the women at reproductive age. In addition to menstrual irregularities, hyperandrogenemia, and polycystic ovarian morphology, PCOS is highly associated with abdominal obesity and insulin resistance. Physical inactivity, weight gain, and change in lifestyle along with genetic predisposition are thought to play an important role in the clinical expression of PCOS. Obesity is a common characteristic in PCOS patient and has been reported that more than 50% of PCOS cases are overweight and obese. So it is a vicious cycle in which inactivity and lifestyle changes can cause a PCOS, which in turn cause a central obesity, which exaggerate the symptoms and metabolic changes in PCOS. Uh, which in turn can cause obesity, and again this is like a vicious cycle which needs to be broken. Incidence of PCOS is increasing day by day in childbearing age group, and it is leading cause of oligo unovulation, oligomenorrhea, infertility, and miscarriages. As there are no ideal pharmacological interventions available till now, the purpose of study is to determine the effectiveness of aerobic exercise in PCOS among obese women. As PCOS can cause symptoms or effect in multiple systems, thus I have chosen an aerobic exercise mainly because aerobic exercise also have effect on many systems. Objective is to review the literature to determine the effectiveness of aerobic exercise in PCOS among obese women. For methodology, it is a review of literature. So thus I have taken an article published between the year of 2010 to 2021, research in the database engines like PubMed and Google Scholar using a keyword aerobic exercise, polycystic ovarian syndrome, obesity. Among 80 articles, 15 articles were selected based on inclusion criteria, that is, women of reproductive age 15 to 40 years with BMI more than 25 who are diagnosed with PCOS by Rotterdam criteria and had no history of regular exercise prior to the study. In a result, out of 15 articles, 5 articles showed reduction, no significant weight loss with improvement of function in cardiopulmonary, metabolic, and reproductive system, while 10 articles showed reduction in weight loss with improvement of function in other system following aerobic exercise in PCOS among obese women. Reduction in body composition could be due to the lipolytic activity of body tissue in response to the aerobic exercise. But 5 articles showed no weight reduction. It could be justified as women with PCOS has relatively high central obesity, also has insulin resistance. That could be associated with smaller fat loss. So mainly with or without weight loss, obese women had improvement in other system. In a reproductive system, it could be explained by visceral fat reduction. Aerobic exercise causes visceral fat reduction and increase insulin sensitivity, which can cause a reduction in androgen production. So in a PCOS woman, when the reproductive system have a effect because of the increased androgen, aerobic exercise can cause a reduction in androgen production, which can improve the reproductive system health. While talking about the cardiorespiratory and metabolic system, it mainly due to the reduction in the insulin resistance, mainly by enhancing the glucose disposal through the increased skeletal muscle capillarization, blood flow, etc. So mainly in the conclusion, it can be concluded that there is a positive effect of aerobic exercise in PCOS among obese women. Clinical significance. it can be obese PCOS women can we can, as a clinician, we can give a aerobic exercise can be prescribed to them for their well-being and health, to improve the health and well-being. Thank you.
A very good presentation, actually. I think it is a much needed one in the women's health concern, because nowadays PCOS is becoming a bigger problem for many women, maybe because of food habits or because of lifestyle modification. Most of that you have told about 5 to 10%. I think it's more percentage there in the PCOS. So you have taken 5 articles, right?
No, sir. I have taken 15 articles.
Okay.
In that, 5 showed there is a weight loss. There is no weight loss, and 10 showed that there is a weight loss.
Okay.
So
do
I have
the
taken
weight loss
15.
have any role on the PCOS? It influences on PCOS?
Yes, sir. Actually, weight loss, when we talk about the central obesity, mainly, if there is that is a visceral fat. So if there is a reduction in the visceral fat, it can improve the reproductive system. But mainly with weight loss or without weight loss, in other system there is an improvement. But if it is weight loss, then it will be better, sir. Hello.
Thank you. Thank you very much. Thank you very much.
Thanks. Thank you, sir.
Now, Pushpendra sir.
No question from my side, sir.
Okay. Duna madam. Duna madam.
Yes, sir. Which one to continue? 17?
Yes,
Niranjan
17.
Meena?
Niranjan. Niranjan.
Check if he is ready. I'm opening the presentation.
Yes, he is ready, madam. Actually, Niranjan, are you there? Niranjan. Okay, we will ask for a Shakshi. I think Shakshi.
Yes, sir.
Yes, please. Yeah.
Sakshi was 18th, right?
Shakshi, your number?
Yes, yes.
18th, no?
Yeah. 17 was Niranjan.
Check if it is visible. Is
Yes,
the slide
it's
visible?
Yes, yes, it's visible.
Okay.
Yeah, I will handle Duna, madam. No issues. I will tell her. Sakshi, are you ready?
Yes, sir.
Please start.
Can I start, sir?
Yes.
Yeah. Good morning to one and all present here. For the QUESTCON 21, my topic is recent advances in osteoarthritis related to the biomechanics. So before diving into my topic, I would just like to brief you about the knee joint. So the knee joint is a large synovial joint which has an articulation between the 2 condyles of the tibia and the 2 condyles of the femur, forming the tibiofemoral joint. And another articulation is between the distal end of the femur and the patella, which form the patellofemoral joint. So basically, what is osteoarthritis? So osteoarthritis is a degenerative wear and tear disorder, which also includes with the articular cartilage loss. So pathology. So when there is articular cartilage loss, there may be tendency of bony erosion, which may lead to osteophyte formation at the end of the joints. So these structure may affect the underlying structure. Meniscus, which is the important structure, which has the congruency factor, which acts as a congruency factor in the knee, has an important role. So in the biomechanics, or when we look into the biomechanics of the knee joint of the tibiofemoral joint, according to Calvin Bone, the convex-concave rule explains that whenever there is a movement produced, there should be a concave and a convex surfaces. So looking over in the in this, according to Ken Ball, he suggests that whenever there is a concave, surface is fixed, there is the movement on the convex which moves on the concave surfaces, which has the movement of rolling and gliding in the opposite direction. So now when a convex surface is fixed, there is also a movement occurring on the concave surface, but the rolling and the gliding movements occur in the same direction. For example, in the knee joint, in the knee joint, the femur is the convex surface and the knee and the tibia is the concave surface. During the knee extension, when tibia is on the femur, the rolling and gliding occurs in the anterior condyles of the femur. Meniscus is pulled anterior due to the contraction of rectus femoris and causing external rotation. So when there is a femur on tibia extension, the femur rolls and slides over the tibia, but there is posterior movement and with internal rotation. During the flexion of the knee joint, tibia is on femur, the gliding movement occurs and the rolling movement occurs in the posterior to the femur with the internal rotation of the tibia. During the flexion and flexion of knee joint, when the femur is on the tibia, there is gliding and rolling movement occurring anterior to the tibia with the external rotation. So since there is narrowing of the joint space, which leads to the meniscus damage, there is rubbing of the tibia on the femur or the femur on the tibia. Since there is no lubrication or congruency, there is hindrance in the movement of the joint. So the PT management I have chosen is proprioceptive exercises, taping. We can do either kinesio taping and dynamic taping. So what is proprioceptive? The proprioceptive help in recreating joint sense and movement pattern by processing the movement to brain. So now kinesio taping. So kinesio taping help in activating and deactivating the muscle. Dynamic taping is used for the biomechanical correction of the muscle and the bony alignment. Exercise prescription. The exercise prescription depend upon the ability of the person to perform certain exercises. So they can be modified according to the person's ability. The repetition, sets, and hold is depending upon the person's ability to do the exercises. So these are my proprioceptive exercises which I would like to give. These exercises can be modified according to the person's ability. Here we can do lunges with the goosey ball. I am giving them a proprioceptive exercises over here. So these kinesio taping exercises are also, kinesio taping may also help in decreasing the pain. I can either activate the muscle and deactivate the muscle. So if I want to activate a muscle, I have to start taping from the origin to the insertion. If I want to deactivate the muscle, I'll be taping it from the insertion to the origin. So conclusion. So the recent advances changes as the new technique sets in, but the concept of exercise therapy with biomechanics correction is the main goal using the advancements made in physiotherapy world today. Thank you.
Yeah, that's a very good topic actually. I would like to ask you one question. You are telling your subjects want to, or we can advise the proprioceptive exercises, right?
Yes, sir.
Is it audible, ma?
Yes, sir.
You are advising for proprioceptive exercises, right?
Yes, sir.
So what are the inclusion criteria? How we include the person to go for a proprioceptive exercises? What are necessary things we have to note down?
So whenever the person's proprioceptive are like age, they're depending upon the age.
You are muted. I think you are muted.
Yes,
Hello?
now unmuted, sir. Yes, we can hear you. Continue.
Yes, ma'am. 1 second, ma'am. Yes. So can you hear me?
Yes, please go.
Age of the person the weight, sir. BMI. Hello.
Yeah, okay, ma. Okay, thank you.
Okay, sir.
Pushpendra sir, any question?
No, ma'am. No, ma'am.
Thank you, Sakshi.
Thank you, ma'am.
I will move on to Niranjan.
Yes, Niranjan, are you ready? Niranjan there? Niranjan is joining, sir.
Yeah, he's joining.
Sir, you kindly communicate with him. I'm opening the presentation.
Yes. Niranjan? Okay, this is the last presentation for morning session.
Yes,
Madam?
yes, sir.
Niranjan, yes, you can speak now. Niranjan, you are still not audible.
Switch on your video, Niranjan. Let me check it once. Yes, try without the headphone. Take off that headphone. Take off that headphone. Without that, try.
Pin remove பண்ணிரு. Device la irundhu pin remove பண்ணிரு. Yes, you speak now.
Still not audible.
Still not
open
audible.
The headphone. Open the headphone from your jack, mobile or device, whatever you are using. Open the headphone jack from your phone.
Okay, we can keep Niranjan's post-lunch first session.
Okay, sir.
Who is next?
Okay.
Final one, 20th one. You can finish.
Next is Anupriya P, 23. Anupriya there?
Yes, ma'am.
Can you join, Ken? Yeah, I will be sharing.
Yes, ma'am.
Wait. Check if it is visible for you.
Yes, ma'am. This is it.
Anupriya, any other device you are using? Two devices or?
No, ma'am. No, sir. Only one.
Okay.
And you need to join cam, Anupriya.
Okay.
You can start now.
Okay. So good afternoon, everyone. My name is Anupriya, and my topic is effectiveness of lumbar extension resistance exercise to improve range of motion and strength in patients with lumbar radiculopathy. So it is a literature review, and my poster presentation registration number is 202100100197. So introduction is lumbosacral radiculopathy is a frequent clinical condition that results from compression of one or more spinal nerve roots and characterized by radiating leg pain and paresthesia, as well as clinical signs of neurological impairment. Studies on interventions for lumbar disc herniation have mainly focused on therapeutic core stabilization, often using body weight exercises or on post-operative rehabilitation. However, based on studies from Steele and colleagues, isolated lumbar extension exercise is superior for strengthening and conditioning of paraspinal lumbar extensor muscles and ensures safe, isolated, heavy loading exercises in controlled movement that is limited range of motion for the patient. So far,
Isolated lumbar extension exercise has only been studied as a tool for post-operative rehabilitation, but not as a treatment option for this patient group. The correlation between the occurrence of lumbar disc herniation and local paraspinal muscle deconditioning to examine the safety and clinical outcome of the isolated lumbar extension exercise rehabilitation program in patients with diagnosed lumbar disc herniation and radiculopathy. Therapeutic approaches aiming to restore the local extensor muscles such as isolated lumbar extension resistance exercise with an exercise device that offers appropriate pelvic restraint have resulted in good clinical outcomes for patients with chronic unspecific low back pain. So objective of my study is to review the published literature on the effect of lumbar extension resistance exercise to improve range of motion in patients with lumbar radiculopathy. Methodology of my study. So the keywords which I have been used is lumbar disc herniation, radiculopathy, isolated lumbar extension exercises, and I have gone through Google Scholar, PubMed, and Cochrane database. And from the year 2010 to 2021, so I have taken 7 studies, out of which one was a case report, 2 prospective comparative study, and 4 randomized control study. So the inclusion criteria is patient who have started the program and had 1 or more diagnosed lumbar disc herniations on an MRI that was not older than 3 months prior to the start of exercise program. And my exclusion criteria is the patient had undergone previous surgical procedures in the spine region, patient diagnosed with degenerative and inflammatory disc disorders such as stenosis and spondylolisthesis. So this is the lumbar extension restraint system, which consists of a headrest, resistance pad, pelvic restraint, seat, thigh restraint, femur restraint, and footboard. So the result of my studies, out of 7 articles reviewed, all the articles proved that isolated lumbar extension resistant exercise showed improvement in pain related disability and return to prior activity with improvement in lumbar extensor strength and range of motion. Discussion and conclusion. An integrated exercise program aiming to strengthen lumbar spine muscles, reduce pain, and stabilize the trunk can help to maintain muscle strength and balance. In addition, improvement in extension strength is expected to be helpful in daily life by securing the range of joint motion and improving the strength and stability. So this is my reference by K. Gion et al. Effects of muscle extension strength exercise on trunk muscle strength and stability of patients with lumbar herniated nucleus pulposus, which was in Journal Physical Therapy Science at 2016. Thank you.
Yes, Arun sir.
Good evening. Is that equipment is a isokinetic like device?
Sir, I didn't get you.
Is the equipment is isokinetic like device? What is the device?
So it is it is in the diagram, sir. It is isolated resistance exercise machine.
Okay, is it isokinetic or like isometric machine? What? Is it like a gym machine or it is
isokinetic? Sir, isokinetic it is.
Isokinetic machine. Yes. So how it is effective when compared to the normal exercises we are usually giving? Normally we are giving strength training, and how it is more advantage than the normal exercises?
So actually in this, to reduce the mechanical stress on the lumbar disc or nerve root, so patient in acute inflammatory stages, they were restricted in flexion in the study. So they are setting up certain range, that is average is 42 degree. So in this patient were instructed to extend their back against the upper back pad by gradually building tension over a 2 to 3 second period. So once the maximum tension was achieved, the contraction was maintained for 1 second before relaxing. So between each isometric contraction, a rest period of about 10 seconds was provided while the patient was moved softly between flexion and extension.
Okay. Thank you, Anupriya. Thank you very much.
Okay, thank you.
Few questions from my side, Anupriya. There is any question in your study on your review article about the pain?
Sir, I didn't get you, sir. Sorry.
There is any questionnaire, any scale, VAS scale, you can check about the pain, rating, the lumbar pain. in your review article?
Sir, actually, they in a result they were mentioning that there was reduction in the pain, so they were using NPR scale.
Okay, NPR scale. And how you
Yes,
what is the outcome measure in the range of, how to increase the range of motion? And any type of scale or any type of instrument or any type of examination you can review article you can done in the check the range of motion exercises.
sir,
Check the range of
it is
motion of the
mentioned.
patient.
No, sir, it is not mentioned like that.
Okay, thank you.
Thank you, sir.
Thank you, madam. Thank you, sir. And we will move on to Niranjan. Niranjan, you there? No.
Sir,
Okay.
you said
Yeah.
will be.
He's there. We will tell him once. That's fine. I have sent a message. Yes, 20 presentations have been over now, madam. Now.
Yes, yes.
Yes. Thank you, Arun sir. Thank you so much for a wonderful sessions you are judging with us.
Thank you,
And
sir. Thank you.
kindly send the score sheet, sir. And evening we will be having Annie madam and again Dr. Pushpendra Advanshi sir. And by 2:30 we will be joined with you all. Kindly stay with us. And there will be a lunch break between 1 and 2:30. We will join by 2:30 again.
Thank you very much.
Thank you, Pushpendra sir.
Thank you.
Thank you, sir. Thank you, Arun sir.
Okay, Dona ma'am and
Thank you,
sir.
Pushpendra
Okay,
sir.
Thank you,
Thank
Arun
you,
sir.
Chandramohan sir. Sir, I am ending the YouTube relay.
Yes,
we will be
yes.
setting another link for that
Yes.
session.
Yes. Pushpendra sir, we will be joining with you again by 2:30.
Chandra sir, I am sending the
Score sheet.
score sheet